Hey y'all, I'm at I-78. Happy Wednesday. Happy Wednesday. Keeping with the theme of the week, which is health and healthcare. We are going to take a look at RFK Jr. testifying in front of the Senate Appropriations Committee. We see what's finally going on. He's going to answer some questions in regards to, from what I understand, the budget cuts happening at HHS, public health programs, medical research, and other things. So let's take a look and see what's going on. All right, y'all. We're just waiting for Forbes to turn the sound on so we can hear what's being said. Let me see if we can find another source. Give me a sec. Y'all up here with no sound. That ain't cute. Oh, no, what I want. Let me see. Hey, y'all slacking. What is going on? All right, y'all. We still don't have any sound. Y'all, you gotta love this. They don't have the mics on because I found it on another stream and it doesn't have any sound either. These cornballs don't have the mics on. You gotta love it. Let's see how long it takes them to figure this out. You gotta love it.
Who are pro-life. I'm encouraged by President Trump's tremendous success in getting our nation's border under control so quickly and so
There we go.
effectively. The president's success in securing our border directly benefits public health by reducing the incoming flow of illicit drugs like fentanyl, which has fallen by 54% since this time last year. And that's no small thing. Similarly, the president's border actions have significantly reduced the number of unaccompanied minors being trafficked into our country. I look forward to hearing from the Secretary about these efforts as well. Also look forward to learning more about the Secretary's plans to reform and reorganize the Department of Health and Human Services. Over the past 2 years, Secretary Kennedy has spoken eloquently to the American people about the urgent need for health care reform. He continued to make the case for reform as he partnered with President Trump to Make America Healthy Again movement. Last month, the Secretary announced a number of structural reform proposals within the Department of Health and Human Services and its numerous sub-agencies, including the establishment of a new administration for Healthy America. Mr. Secretary, I appreciate the preliminary details of this plan that you have shared with us, and I look forward to hearing more this morning. Congress has also been engaged on the urgent need to reform our healthcare agencies. Last year, I was pleased to work with our colleagues on the Energy and the Commerce Committee to initiate reform proposals for NIH, or the National Institute of Health. I'm encouraged to see that the administration is building off of this process by making additional reform proposals at the National Institute of Health. I look forward to hearing more details about that, your proposal, and to continue in a dialogue between the department and the Appropriations Committee as we begin the budget process in earnest. Mr. Secretary, I'm sure you know all too well that implementing reforms in Washington is no easy task. However, the President has asked you to take on this weighty challenge, and you have accepted that challenge. We here in Congress want to partner with you, bringing our own experience to the table as elected representatives of our communities. We share your goal to make America healthy again, and we look forward this morning to your testimony here today. And with that, I'd like to turn to our ranking member of the Appropriations Committee, Ms. DeLauro, for any opening remarks that she may have. Ms. DeLauro, you're recognized.
Thank you very much, Mr. Chairman, and thank you for holding what is a very critically important hearing on President Trump's disastrous budget request for the Department of Health and Human Services. Secretary Kennedy, good morning to you. We welcome you to the House Appropriations Committee for your first budget hearing. However, I cannot thank you for the Trump administration's budget request to cut funding for important health programs by $33 billion. Quite frankly, I view it as a disgrace. Under your budget proposal, Americans would die of needless and preventable deaths. But before we talk about the request to cut tens of billions of dollars next year, I would like to talk about what is happening right now. The American people are demanding help with the cost of living, but President Trump is not laser focused on the cost of living crisis. He is actually making it worse. He promised to fight for the working class, but instead put Elon Musk and billionaires in charge of the government, and you to destroy everything we know about good public health. Mr. Secretary, this administration is recklessly and unlawfully freezing and stealing congressionally appropriated funds from a wide swath of agencies, programs, and services
This ain't been on 10
across
years
the
before she
government
started hollering
that
about
serve the
Elon
American
Musk.
people. And recall that this is a violation of the Constitution. The power of the purse resides with the Congress. It's Article 1, Section 9, Clause 7. Yourself and President Trump and Elon Musk are attacking health programs to pay for tax cuts for billionaires. And by promoting quackery, we are endangering the health of the American people with pseudoscience, fear-mongering, and misinformation. Government should fight for the middle class, the working class, and the vulnerable, not the interests of billionaires like Elon Musk. Instead, with you at the helm, the Trump administration and Republicans in the Congress are destroying the crown jewels of our health system. The National Institutes of Health,
Did she visit talk
Centers
about
for
promoting
Disease
crackery
Control
with
and
that wig she got on?
and the
Is she
Food and
serious?
Drug Administration. At the NIH, the world's largest funder of life-saving biomedical research,
What y'all been
you
doing?
and Elon Musk have fired or driven out nearly 5,000 personnel, including some of the world's most preeminent scientists, frozen billions of dollars in research to develop cures for cancer, Alzheimer's disease, women's health, and the list goes on. China and Europe are taking advantage of this disaster by recruiting American scientists away from the United States. China wants to overtake us as a global leader in health research and innovation. You and President Trump are aiding and abetting them. 2 weeks ago, I called a hearing on the cuts to CDC because the Republican majority is refusing to hold this administration accountable for its wanton destruction. As part of your drastic and haphazard purge of CDC, you and Elon Musk eliminated entire divisions without consideration of what is being lost. More than 70%
No, they not. We
of
take more of them than
CDC's
they
funding
take of us.
is
What she
provided
talking
to
about?
state and local jurisdictions. These cuts affect families and communities in every one of our districts. These cuts are dangerous. Dr. Peter Marks, the country's top vaccine regulator at the Food and Drug Administration, helped to develop the COVID vaccines at record speed under the first Trump administration. Dr. Marks was told to resign or be fired. In his resignation letter, Dr. Marks wrote that, and I quote, "It has become clear that truth and transparency are not desired by the secretary, but rather he wishes subservient confirmation of his misinformation and lies, end quote. Mr. Secretary, Dr. Marks was talking about your misinformation. He was talking about your lies about vaccines. Mr. Secretary, you are gutting the life-saving work of the Department of Health and Human Services and its key agencies, while the Republicans in this Congress say and do nothing. But the destruction of HHS is not limited to NIH, CDC, and the FDA. Mr. Secretary, you are eliminating entire agencies that have saved the lives of someone near and dear to each and every one of us. Because of these cuts, people will die. Substance Abuse and Mental Health Services Administration, SAMHSA, eliminated. Health Resources and Services Administration, HRSA, which, as you know, is responsible for ensuring access to health care for the uninsured, isolated, and vulnerable people, eliminated. The Administration for Strategic Preparedness and Response, ASPR, which was created to prepare for and respond to public health emergencies, eliminated. The Administration for Community Living, ACL, eliminated, hurting seniors and people with disabilities. You can make the baseless claim that you are simply reorganizing these functions of HHS all you want. It is simply a matter of fact that you cannot cut the department's budget and maintain all of its life-saving programs and services. HHS has closed half of its regional offices, which serve 22 states and 5 territories. 20,000 HHS employees are gone. And Republicans have set the stage to cut Medicaid benefits from people who rely on that program to see a doctor, including roughly half of our nation's children. HHS has terminated more than $12
Child, if
billion
you don't be
in
quiet,
funding
you
for state
can't
and local health
guarantee
departments,
that
including
everybody's
funding
gonna
for
have
mental
health
health,
coverage
substance
unless you
abuse
just straight
programs,
up give them
treatment,
health coverage. So
sabotaging
since that's not what
our
y'all doing,
progress in
let it go.
addressing the opioid crisis. Mr. Secretary, you are eliminating scores of CDC prevention programs, including HIV, tobacco, drowning, asthma, lead poisoning, and gun violence. Why on earth are these the places you are terminating for so-called waste? The life of a teenager that does not become addicted to cigarettes or injured by a firearm is not waste. Last month, you wrote in the New York Post, and I quote, "America has the highest rates of chronic disease in the world. We rank last in terms of health among developed nations, and life expectancy is declining for many groups of Americans." Mr. Secretary, much of what you wrote is true, but it is confounding and incomprehensible to then turn around
Okay, this is gonna
and
be a long one.
eliminate the
Let me burn
CDC
some
Center for
incense,
Chronic
'cause I
Disease
see now I'm
Prevention
gonna need
and
it.
Health Promotion. And with respect to views on vaccine, quite frankly, I believe you are promoting quackery. Under your watch, our country is now failing to contain vaccine-preventable diseases. Measles, a disease eliminated in the United States just decades ago, has now claimed the lives of 3 Americans, including 2 children who died needlessly, and over 1,000 are confirmed to have contracted the disease. All while you peddle unfounded and dangerous vaccine skepticism, spread lies and misinformation about people living with autism. Vaccine programs for millions of Americans, including children. We do that so that they do not get these diseases like measles. This is not a waste.
Okay, well, if it was
Thousands of experts and experienced
why
staff will help keep
the
America
lives
safe
of
from global
Americans?
infectious diseases like measles,
Think about
polio,
what
HIV, tuberculosis, and Ebola are not waste. These programs help to save the lives of men, women, and children from all walks of life in this country. And you have decimated the Food and Drug Administration by firing 3,500 employees, taking a wrecking ball to FDA's food safety mandate. You talk about making our food supply healthier while gutting the support staff for critical inspections of things like baby formula. You talk about closing the generally recognized as safe or GRAS loophole, which allows food companies to determine the safety of their own ingredients, something that I have advocated for years, but while firing staff in charge of food and chemical reassessment. The former deputy commissioner of the Human Foods Program resigned in February, writing, and I quote, "I was looking forward to working to pursue the department's agenda of improving the health of Americans by reducing diet-related chronic disease and risks from chemicals in food. It has been increasingly clear that with the Trump administration's disdain disdain for the very
Wait a
people
minute. So you sit up
necessary
here talking about it's a good
implement
idea to
your
let the
agenda.
manufacturers
However,
determine
it
whether or
would have
not
been
what they're
fruitless for me
manufacturing for
to
profit
continue
is
in this
healthy.
role.
That makes
End
absolutely
quote.
no sense.
That's a damning indictment of your work on food safety. I'm worried. I'm worried about a future public health crisis that emerges once the Trump administration has fully dismantled the nation's public health system. We are currently in the midst of an outbreak of avian influenza, and this administration is woefully unprepared to protect Americans and mitigate its impacts if it transforms to be transmittable from person to person. This is all happening today, right now. We are not talking about hypotheticals or what ifs or worst case scenarios. This destruction has happened and is happening today, right now. Even though we received President Trump's concept of a budget plan on Friday, we are now into May without a real budget from the White House. Mr. Secretary, in the budget outline, you are asking Congress to cut funding for health programs by $33 billion, a cut of more than 25%. You are asking Congress to cut CDC by nearly $4 billion, NIH research by $18 billion, and you claim to be reorganizing NIH. Any reorganizing of NIH must go through the Congress. We need to hold public hearings, engage in a thoughtful process to incorporate the best ideas to advance NIH as a crown jewel of biomedical research. Mr. Secretary, you have no lawful authority to undertake this by yourself. These are vital institutions built up over decades that protect Americans' health and the health of people around the world. I do not believe the American people want less cancer research, fewer people tracking infectious diseases, but that is exactly what this budget will deliver. We are in the middle of a cost of living crisis, driven in part by skyrocketing healthcare costs, and you and Elon Musk and President Trump are making it worse. You are wreaking havoc at every level of our most critical health institutions. You are jeopardizing our families' health for the sake of billionaire tax cuts, but we are seeing pushback at every level. The public is outraged at the enormous harms you have wrought. Dozens of courts have put restraining orders on the administration's actions, but the courts can only play defense. Republicans in this Congress could stop the mayhem, the chaos, and the destruction today if they had the courage, but they remain silent, petrified of the president's scorn, revenge, and retaliation. Those of us who serve in elected office, we are blessed and we have the power to do something. We know what's right and we know what's wrong, and we understand the harm being wrought on the American people. We need to stand up, not be afraid. This is the time to meet the moment. As a top Democrat on the Appropriations Committee, I will never stop fighting against this dangerous dismantling of health and human services and its agencies, which is jeopardizing the health, the safety, and the well-being of millions of America's families. Thank you. I look forward to your testimony and to the important conversations we will have in this hearing this morning. I yield back, Mr. Chairman.
All right, Mr. Secretary, we look forward to your opening remarks. You're now recognized. Of course, your written statement will be included for the record, but you have the floor, and we look forward to your testimony.
Thank you, Ranking Member DeLauro and members of the committee. I'm honored to appear before you today to present the Department of Health and Human Services fiscal year 2026 budget. Debilitating disease, contaminated food, toxic environments, addiction, mental health illness affect families across every race, class, and political belief. When my team and I took the helm at HHS, we set out with clear goals. First, we aimed to make America healthy again, with a special focus on the chronic disease epidemic. Second, we committed to delivering more efficient, responsive, and effective services to the over 100 million Americans who rely on Medicare, Medicaid, and other programs. Third, we focused on achieving these goals while cutting costs to taxpayers. We intend to do more, a lot more, with less. The budget I'm presenting today supports these goals and reflects two enduring American values: compassion and responsibility. I invite the committee to unite around these ideals with me. The United States remains the sickest developed nation and we spend $4.5 trillion annually on healthcare, 2 to 3 times more per capita than comparable nations. Clearly, something is structurally and systemically wrong with our approach. Furthermore, healthcare costs are steadily increasing at a rate 2% greater than the economy. If we don't staunch this unsustainable hemorrhage, we will ransom our children to bankruptcy, servitude, and disastrous health consequences. Yes, an exploding debt is a social determinant of health. We won't solve this problem by throwing more money at it. We must spend smarter. We will shift funding away from bureaucracy toward direct impact. Some things at HHS will not change. We will preserve legacy programs like Medicare, Medicaid, and Head Start as the foundation of the MAHA agenda. Vulnerable populations, seniors, and veterans deserve consistent access to care, and I will ensure that they receive it. Today, 83 million Americans, urban and rural, lack adequate access to primary care physicians. We will prioritize these families, especially Native Americans and Alaskan communities. We will protect IHS funding, streamline its operations, and give the tribes more autonomy for managing their resources. Let me be clear, we intend to make the Trump HHS not just the most effective, but also the most compassionate in U.S. history. Our official budget statement outlines many priorities, but I will highlight a few. First, we will consolidate programs to better tackle mental health and addiction. These issues now rival chronic disease in their impact. HHS will aggressively combat the opioid crisis, especially the spread of synthetic drugs like fentanyl. We will empower state, local, and tribal leaders to create effective solutions. Second, we will address nutrition, physical activity, and healthy lifestyles. The President's budget requests $94 billion in discretionary funds to support these priorities, including the Administration for a Healthy America. We will emphasize healthy eating and Head Start and ensure the program continues to serve its 750,000 children and parents effectively. Third, we will equip the FDA to expand its food safety efforts through research, regulations, independence, and education to remove harmful chemicals from food and packaging. And we're already doing this more aggressively than any other administration in history. We will fund cutting-edge research at the NIH while cutting risky or non-essential services. That includes ending of gain-of-function experiments and research based upon radical gender ideology. At the CDC, we'll return to its core missions, tracking disease, investigating outbreaks, and sustaining public health infrastructure while cutting waste. And I'll add, in response to your critique about the measles, we are doing a better job at CDC today than any nation in the world at controlling this measles outbreak. I'm happy to elaborate on that afterward. Fifth, we will eliminate DEI funding and redirect resources toward real poverty reduction. We will move beyond lip service to communities of color and take meaningful action to meet their needs. Six, we will strengthen cybersecurity and health IT. The AI revolution has arrived, and we are already using these new technologies to manage healthcare data more efficiently and securely. Finally, we will rebuild public trust that eroded through years of industry capture, corruption, waste, and misplaced priorities, including by some of the gentlemen that you just mentioned, Ranking Member. We will launch a new era of transparency in public service, creating an honest, science-driven HHS that answers to the President, to Congress, and to the American people. I look forward to working with Congress to pursue this mission together as a bipartisan cause. Let's work side by side to make America healthy again.
Thank you, Mr.
Mr. Chairman,
Yes, sir.
we have another committee meeting of which I'm the ranking member. I will be back, but I didn't want Mr. Kennedy to think Secretary Kennedy walking out.
Duly noted.
I welcome your absence, Congressman Hoyer.
I'll be back.
right. Thank you, Ms. Secretary. I will begin. I mentioned in my open remarks that I appreciate your commitment to upholding the sanctity of human life in your capacity as the Secretary of Health and Human Services. The pro-life community was deeply concerned by numerous actions that was taken during the Biden administration that undermined the right to life and the conscience of rights of pro-life Americans. For example, the Center for Disease Control revealed at the end of the Biden administration that the CDC funded nurses in Mozambique were performing abortions that violated the Helms Act, which prohibits U.S. foreign aid from funding abortions. In addition to that, the Biden administration punished states by denying them Title X funding for refusing to provide abortion counseling in violation of state law. Can you talk to us for a couple of minutes or whatever about steps that you see the department are now taking to protect the right to life and the conscience rights of pro-life medical providers and also medical students?
Yes, Mr. Chairman, every abortion is a tragedy. I don't believe that our nation can live up to its role as a moral authority around the globe when we have hundreds of thousands, if not a million, abortions per year in our country. And under President Trump's leadership, I have ended federal funding to the kind of the programs that overseas programs that fund abortions or counsel abortions. And we have withheld the Title X funding from NGOs that refuse to differentiate the funding streams so that the federal government and my agency can't tell whether money that is being sent to that agency is being used for legitimate family planning issues, or it's being used to counsel or fund abortion. And we have said that as soon as they differentiate that, we would begin refunding them. I think at this point, the administration is now fed up with that. And the budget that is proposed by OMB is a budget that cuts out Title X funding because they don't believe that these NGOs can actually, in good faith, comply with the law and with the EOs.
Thank you. Well, I appreciate that, and like I said, I appreciate your commitment to that for the president's vision. One of the most significant challenges facing rural hospitals is the area wage index, which is used, of course, by the Center for Medicare and Medicaid Services. And as you know, under the reimbursement formula used by CMS, mandates that the area wage index remain budget neutral, and high wage hospitals receive a higher reimbursement rates, whereas low wage hospitals receive a lower reimbursement rate. This system has the perverse result of preventing low wage hospitals, many of which are in rural areas and underserved communities, from paying higher wages. By keeping these hospitals at the lower end of the wage spectrum, they cannot compete against higher paying hospitals, increasing their risk of closure, which I referred to earlier, and locking them into a downward spiral. During the first Trump administration, CMS attempted to address this disparity. However, the Biden administration did not successfully defend the policy when it came to the courts. Therefore, rural hospitals again confront this downward spiral of the CMS area wage index. Can you tell us if CMS has taken any steps under your leadership to review the impact of the area wage index on rural hospitals? And can I get your commitment to work with me and, of course, with Administrator Oz on a solution to this very critical problem that's affecting so many rural hospitals?
Yes, Mr. Chairman. As you point out, the Trump administration initially tried to address this disparity, which is destroying rural healthcare. And as you know, many of these rural hospitals not only provide critical access to care, without them, patients would have to drive sometimes hours to get to an emergency room. They're absolutely critical in those regions, but they're also important economic drivers for many of those regions. And they're institutions that provide cohesion to those communities. Oh, if we want to preserve rural America as a livable space with dignity, enrichment, prosperity, and good health that they deserve, we need to keep those hospitals in and those treatment institutions in good shape, in good financial. We need to keep them financially viable. The Trump administration, the initial Trump administration, 2016 to 2020, tried to do that. Unfortunately, as to redress those disparities. Unfortunately, as you know, as you pointed out, the Biden administration did not robustly respond to a court challenge, and we got a very bad decision from that. That said that my agency has no power to redress this disparity. But I pledge to work with you and with Congress. Change has to be statutory, and we will do our job at providing technical support, including the kind of studies that you just mentioned that show how badly this disparity is wounding rural America.
Yeah, well, thank you. And like I said, someone who represents a rural state, it is certainly, I hear about it almost every day or very frequently. So I appreciate your commitment to that. With that, let me recognize the ranking member, Mr. Lauro.
Thank you very much, Mr. Chairman. Let me just one area of correction, which has to do with the measles issue, Mr. Secretary. You keep comparing the U.S. to other countries. You compare us to Europe, but the Europe you are referring to is the WHO European region. That's 53 countries in Europe and in Asia, including those with low vaccination rates like Romania, that has never eliminated measles. If you compare us to Western Europe countries that we often compare ourselves to, like Great Britain, they have seen no measles death this year. Let me move to the NIH. In your testimony, you say you want to quote, and I quote, rescale our biomedical research budget, unquote. Excuse me, but that's BS. You are not rescaling NIH research. You are proposing to cut it by $20 billion. And according to our colleagues in the Senate, NIH has effectively cut research funding by $2.7 billion this year in comparison to the same period last year. That's a cut of 35% during that period. That includes cutting cancer research by 31%. This is the report put out by the Senate, Trump's War on Science, which goes into detail about how we are, in fact, dealing with cutting scientific research. Mr. Secretary, are you freezing or withholding funding that Congress appropriated in 2025 for life-saving NIH research?
Let me address your first issue first, because I want to correct you. We have about 1,100 measles cases in this country. The growth rate last year was 15 additional, so we have plateaued. Mexico has roughly the same number with a third of our population, and they got 300 extra cases last week. Canada has more measles, 1,500. They have 1/8 of our population. Western Europe has about 6,000, which is 10 times the number that we have. Well, you are wrong about what you said earlier.
We can discuss that, but I think one has to consider whether or not we're dealing with decades of data proving how effective and safe the measles vaccine is. I want to move to that. I want my questions answered on, are you freezing and withholding funding that Congress appropriated in 2025 for life-saving NIH research?
We are not withholding any funding for life-saving research.
Okay. Do you commit to following the law?
Of course.
Fully obligating funding that Congress appropriated. We appropriated, it is the law of the land for NIH research, and to obligate those funds by September 30th of this year. or are you planning to break the law by impounding congressionally appropriated funds?
If you appropriate
you
the
wasting up a
funds,
lot of
I'm going to
time with
spend
this,
them.
'cause
We
you
have
not
in the bill, you are cutting the
one
NIH
solid
by
point.
$18 billion, or you're proposing to cut it by $20 billion. The Congress appropriated those funds. It passed into law. It's part of the 2024 budget, and we are under a continuing resolution that has adopted the 2024 numbers. How then can you justify cutting $20 billion from the biomedical research budget?
If you appropriate the money to me, I'm going to spend that
We
money.
have appropriated, Mr.
Right, then I'm going
Secretary.
to spend it.
Then you're going to spend, you're not going to cut $20 billion from the NIH.
The White House proposal is to do very, very large cuts at NIH.
Well, that is contrary to
but
the
if-
money
if Congress-
appropriated.
Ranking member,
Yes.
if Congress appropriates me the money, I'm going to spend the money. You have the power of the purse here. I'm
Thank
sure
you.
know that.
Thank you for reiterating that. But I think that I'm not sure the administration really has internalized that. Particularly, Mr. Vogt hasn't internalized that when he says that we can in fact impound
These-
money. The
these are-
money is there. The 2024 budget includes the funding for the NIH. Will you commit to spending the money that is in 2024 in that budget?
As I said, ranking member, if you appropriate the money, I'm going to spend that money.
The money has been appropriated. So the answer to that is if you're not willing to accept the funds that have been lawfully voted by members of the House and Senate on the money for the National Institutes of Health. We're going to hold you to your word that that funding is there. It should be transferred from 24 to 25, and you've cut already $20 billion. Let's get that money back. Let's get that money back. You have an obligation to carry out the law and to implement what the Congress has done. Unbelievable. Unbelievable. Chronic disease and tobacco. Tobacco use is a major contributor to chronic disease and is a leading preventable cause of death in our nation. Each year, killing nearly 500,000 Americans, costing the nation nearly $250 billion in healthcare costs. CDC's tips from former smokers media campaign alone is estimated to have saved more than $7 billion in healthcare costs by helping more than 1 million smokers quit. Why did you eliminate CDC's Office of Smoking and Health, an office that reduces the number of kids using tobacco products, helps audit tobacco users to quit, and saves taxpayers dollars?
We have, under the reorganization, and I'm going to talk very, very broadly, because as of 4 o'clock yesterday afternoon, we are under a court order not to do any further planning on the reorganization. And I've been advised by my attorneys and not to talk about it. But I will just say broadly, many of the programs that the Democrats are now saying were cut at CDC were not cut at all. Those programs were transferred to the Administration for Healthy America. But I'm not permitted to talk in any more detail because of a court order.
I know we're just dealing with words. You transfer it here. There's less money overall for the agency. Therefore, there's less money for the programs. In both 2024, 2025, Congress, again, power of the purse resides here, appropriated $246 million for CDC's tobacco prevention programs. Do you commit to following the law again, fully obligating those funds so that we can help adults who want to quit using tobacco and prevent teens from becoming addicted?
Allow me to answer that by pointing out the absolute cataclysmic disorganization of this agency under your oversight for 40 years. We had 9 separate offices of women's health. When we consolidate them, the Democrats say we're eliminating them. We're not. We're still appropriating the $3.7 billion, but we're not keeping all 9. We had 8 separate offices for minority health. We eliminated 1. We had 27 HIV offices.
Okay, let me just, I'm going to
We had 59 behavioral health programs.
I'm well over time. If you could just get us what has been eliminated, why you're doing it, and the criteria by which the elimination has occurred. That is information that this committee needs in order to be able to do our job in terms of appropriating funds. Thank you.
And
for
we
your
will
indulgence.
gladly provide that to you, but right now we're under a court order that prohibits us from doing so.
Okay, before we go on, I just want to say, we also need to make sure that we bear in mind that the secretary is here talking about FY26 funding. So he is committed to that. So I just want to make sure that we're all clear. We're talking about FY26 on this. Mr. Simpson.
Thank you, Mr. Chairman, and thank you, Secretary, for being here, and thanks for taking on what is a huge task. You've done that
Again,
before
if
in
you
your
ain't
history,
figured out
and,
how
I
not
look
to
forward
get
to-
HIV, I don't
most
know
of the
what to
people
tell
I
you.
talk to are in favor of MAHA and making America healthy again. I agree with a lot of the things you said. Some of the things I question, want to see more studies on. And there's probably a couple in there that I might disagree with, but that's okay. Opening this debate of how we can make America healthy again is very important. Let me ask a couple questions. I chair the Interior Committee that funds Indian Health Services, which is in your department. I noticed in your opening statement, you want to maintain the level of funding for Indian Health Services to keep the promises that we've made to our Native American, Alaska Natives. That's not just a promise, that's a legal obligation we have with those. Those are treaty rights. So we've been doing a great deal in my bill, increasing funding for Indian Health Services. We also did something that was called forward appropriations so that they have appropriated a year in advance, because we found
Nah,
that
Andy, that's where your parents come
during
in.
shutdowns
Like,
and
let's
those
be
kind of
for
things,
real.
they
That's
weren't
where your
protected
parents
like
come
other
in.
health
That's where the internet
organizations
come
were and
in.
stuff.
That's where the library
Your
comes
skinny
in.
budget,
So I don't take all
and
of this.
I haven't seen your full budget yet. Do you maintain that forward appropriation for Indian Health Services?
Yeah, yes, Congressman, I want to point out, I spent 20% of my career working on tribal issues, representing the tribes in treaty negotiations and in litigation against big polluters in the extractive industry and others. I was one of the founding editors of Indian Country Today, which is the largest Indian newspaper in Indian country. And it's been an issue that I've been committed to my whole life. I fought successfully to exempt the Indian Health Service from the probationary freezes, from the fork in the road, the early retirement, from the RIFs, and from all of the downsizing. And I also made an opportunity that people who at my agency who lost their jobs in other parts of the agency from the RIFs, et cetera, could transfer to Indian Health Service, because Indian Health Service is chronically understaffed. It's very, very difficult to find competent personnel who will move to Indian country or to distant locations.
Right.
Well, I'm committed to protecting it. I'm committed to working with you to make sure that that we can finally make this work. Our population that is not only probably, among the most aggrieved in our history, but also a population that suffers more from chronic disease, that has the shortest lifespan, the highest rates of diabetes, the highest rates of alcoholism of any other population. And one of my big priorities will be getting good food, high quality food and traditional foods onto the reservation, because processed food for American Indians is poison.
Yep. They're finding that the way to attack diabetes on reservations, which have the highest rate, is by going back to their traditional foods.
Yeah, I'll say one thing. The Pima Indians were blue zone in Arizona, the longest lived people on the continent. Today, they're among the shortest lived. I think the lifespan at around 47 years old. The highest rate of diabetes, second in the world.
Yep.
About 80% of adults are diabetic, have chronic obesity. Right across the border in Mexico, there are Pima Indians who are still long lived, have no diabetes, no heart disease, no obesity, because they're not being fed ultra processed food. Ultra processed food is a genocide on the American Indian, and we have to end it.
Yeah, I agree. One other subject that I want to talk about is the reorganization of NIH into fewer institutes. There are some institutes that are concerned that they're going to be left out of this reorganization. The Division of Oral Health at the CDC is concerned about the lack of focus on oral health. Will you commit that preserving the congressionally appropriated funding and upholding the autonomy of the National Institutes of Dental Craniofacial Research and other institutes until Congress completes a thorough review of the NIH restructuring?
I don't know what the OMB budget says about dental health, but I can tell you that I am deeply committed to dental health. There are so much new science out there that shows how dental health is intricately related to health in the rest of the body, to the microbiome, to the brain health. So, we want to do those kind of studies to make sure that we understand that, and we need to make a big commitment to dental health.
I appreciate that, and I look forward to working with you on that and making sure that, most diseases can actually express themselves in the oral cavity first.
Yes.
It can be detected there. I am concerned about the fluoride issue. I've seen the benefits, having been a practicing dentist for 22 years. I just noticed this morning that the FDA brings action to remove ingestible fluoride prescription drug products for children from the market. And as I'm reading through this, I want to see some of these studies, but it says the best way to prevent cavities in children is by avoiding excessive sugar intake and good dental hygiene, obvious. Then it says, for the same reason that fluoride may kill bacteria on teeth, it may also kill intestinal bacteria important to children's health. I would tell you, you don't prevent cavities by fluoride killing the bacteria in the mouth. What it does is make the enamel more resistant to decay. So I want to see the studies on this and where we're headed with this. And I will tell you that if you are successful in banning fluoride, I noticed you congratulated Utah and Florida, I think, for banning it. That's up to them. They can do what they want. But we better put a lot more money into dental education because we're going to need a whole lot more dentists.
Oh my God! So if you
I
brush your
think
teeth,
that, Marty McCary is concerned with
at some point
ingestible
during the day.
fluoride, is that the emerging science shows the benefits.
Okay, and not everyone has someone in their life
fluoride to
what they
cares
need to know. So you think they're going to
cavity
do
prevention
government
comes
research
from
to get this
topical
information? Let's stop
exposures
playing.
rather than it was once thought that it was systemic, that if you ingested it, that the benefit came from that. We now know that virtually all the benefit is from topical, and we can get that through mouthwashes. We can get through fluoridated toothpastes. The National Toxicity Program issued a report in August, a meta review of all the science that now exists on fluoride, and showed a direct inverse correlation between fluoride exposure, dose-related, and lower IQ. It's an issue that we have to all be concerned with. We want high IQ kids.
Mr. Hoyer,
right now.
Mr. Hoyer.
I appreciate that. And I look forward to working with you on it.
Okay.
As promised, I returned.
You and McCarthy.
Me and MacArthur. I'm not going to ask questions about specific issues about which I'm very concerned. I subscribe, frankly, to the remarks that Mr. Lauro, our ranking member, made, however, Mr. Secretary, with reference to my concerns about what is happening. First of all, let me ask you this.
Sorry about that.
You submit a budget, it goes to OMB, the president will submit it to us.
Well, listen, if they don't
and
have
Congress
a
passes
decent
a
parent
budget,
to,
sends
give
it to
them
the
this
president,
information, why
and
you
when the
think these
president signs
same
Once that happens,
non-decent parents is taking
you
them to the
consider
doctor's
that
office?
budget that Congress passes to be a suggestion or directive?
Well, as far as I'm concerned, it's the president's budget, and my duty is to defend it. It's Congress's choice about whether or not they're going to fund. The Congress appropriates the funding. There is, Congressman, there's no agency head that I know of that wants to see his agency gutted or his budget lowered. There's tremendous waste in my agency. It grew by 38% during the Biden administration, and public health went down.
Okay, I got 5 minutes.
Right. But I just say this. President Trump has a broader vision than me, which is that the $2 trillion we're spending a year that we don't have is landing on our children. That is a health crisis for them.
Mr. Secretary, my question to you respectfully was, do you believe it is a suggestion or a mandate? This is a very important issue, which we differ greatly with the administration and with Mr. Musk, that willy-nilly, without Congress's approval, they can remove things, take things away, defund things, fire people. That
mean
is
the
not
same
my
ones that he was just on
proposition. I
talking
wanna know
about
whether
what
it is your
Monday,
proposition.
when he signed the
You've
executive
answered
order
in the
telling them
sense
they're
that
gonna have to
once
renegotiate
the
their
budget is
prices,
adopted,
them
you
the
need
ones
to
he about to
carry
make
that out.
money for?
Now, whether
Okay.
that was President Trump that signed that budget or President Biden that signed that budget, I presume your premise is the same.
Oh,
Is that
you know,
correct?
I mean, I don't know whether you're asking me a rhetorical question because I think it's
No, it's not a
self-evident.
rhetorical question. It's whether or not you think once the Congress says we're going to
Right.
spend X number of dollars on X objective, Y objective, that you will follow that.
Yes.
Okay, that's the answer I wanted. Um, The
And incidentally, that happens throughout history. You know, the Republican.
No, throughout
president-
history, Mr. Secretary, with all due respect, you and I know this. Mr. Nixon said that was not the law, that he could take whatever and he took it as a suggestion. And he wanted to impound. And he did impound in the early 70s. And we passed an act that said you can't do that. Then the Supreme Court heard that case. And very frankly, one of the most conservative judges, Justice Scalia, said President Nixon, the Mahatma Gandhi of all impounders, asserted at a press conference in 1973 that his constitutional right to impound appropriated funds was absolutely clear. Scalia went on to say, our decision 2 years later in Train versus City of New York proved him wrong. That opinion has been reiterated by the Supreme Court subsequent to that decision. This is a critically important issue because there are conflicting opinions. We will try to come to consensus on that. The president has to sign the budget unless we override his veto of the budget. That becomes the law. We think, and a lot of courts over the last 2 months have decided that law is not being followed. So that was my point. Well, let me ask you something. You've reduced the department by 20,000 people, as I understand it. You've been quoted as saying some of those firings were mistakes. In fact, of course, Musk fired 70% of the people when he bought Twitter and then brought a large number of them back because he found out, as you point out, not that with respect to that, but with respect to these 20,000 people, there were mistakes. My question to you is, have you had an analysis prior to making those decisions or Mr. Musk making those decisions? And I ask you first, who made those decisions, you or Musk?
They were made, I mean, ultimately, we executed the decisions.
I know you executed them, but my question is,
Elon Musk gave us help in figuring out where there was waste, fraud, and abuse in the department. But it was up to me to make the decision. And there are many instances where I pushed back and said, we don't want to, that would hurt us to eliminate that group.
let me ask you a question based upon that response. Was there an analysis of the consequences of these cuts and the reduction in force and elimination of programs? Was there an analysis that you can provide the committee that indicated those, as you concluded in your statement, would not harm people, would not undermine, frankly, the people who are being served, the healthcare not delivered, people not served, children not educated, research not accomplished, frankly, lives not saved? Is there an analysis that you can provide to this committee prior to us determining the budget that will show that, in fact, those cuts will not be harmful to those objectives?
Yeah, I mean, yeah, there were analysis. The simplest analysis was at the outset, the analysis that we're spending $2 trillion a year that we don't have.
Mr. Musk
At
said he was
some
going to
point,
cut
when you're
$2 trillion.
spending $2 trillion more than you have to make cuts. The other analysis that was more detailed
You cut
is
them
that
children or the Indians that you're so concerned about?
we didn't cut the Indians. We didn't
No, I
cut the
understand
Indian
that.
services.
I'm asking you, you said we have to
I
cut.
made sure that those services were not cut. I made sure that Head Start was not cut. But the cuts that were done were cuts that were to duplication, to redundancy, to streamlining. We increased our workforce 70% in 4 years. So we were going back to the 2019 levels.
Mr. Reagan,
And I would ask,
Mr. Reagan said he was going to cut waste, fraud, and abuse. He increased the budget deficit by 189%, the highest of any president in history.
No analysis.
I am,
you.
we're allotted 5 minutes and I am trying to be lenient, instead
I
of cutting
appreciate
somebody
it.
off in mid-sentence, but if y'all could be respectful to me so that we can sort of wrap up when I start tapping. So anyway, let me recognize Mr. Flashman.
Thank you, Mr. Chairman. Mr. Secretary, good morning. I'm Chuck Flashman. I represent the 3rd District of Tennessee. That's East Tennessee, Chattanooga, Oak Ridge. I want to thank you for stepping up in this important role and serving our great president, President Trump, in all of your endeavors. I want to begin with a thank you, because I am going to have some questions later about some other issues, but thanking you for the Center for Medicare and Medicaid Innovation under HHS, what it does with Oak Ridge, which was the birthplace of the Manhattan Project, Oak Ridge National Laboratory in my district. It works to make sure that the Energy Employee Occupational Illness Compensation Program at the Department of Energy is run well, and it is. This keeps our hardworking civilian employees insured and cared for long after their years of service. So that's a profound thank you to you and yours for running that so well. Mr. Secretary, I'm going to talk a little bit about the Food and Drug Administration. That is under my dear colleague and friend Andy Harris's jurisdiction. I chair Energy and Water. But while I have you here, Mr. Secretary, I know the FDA has taken significant steps to ban or phase out synthetic food colorings over the years, and I respect that. The current colors, though, Mr. Secretary, that are used and have been approved by FDA have been deemed safe for many years. Candidly, I represent many snack manufacturers. I'm a big fan of the oatmeal cream pie. And in many ways, I have M&Ms in my district. I know you're going to come and visit me in a couple of weeks. We can all have some M&Ms and Little Debbie's together. But on a very serious note, we want to make sure that FDA has done due diligence to ensure the safety of these replacement colors. Will you work with me on that? Because candidly, I think these dyes are safe. They've been approved, but really trying to find substitutes, the costs, we've seen estimates 5 to 10 times try to fix that. Will you work with me on that, sir?
Absolutely, Congressman. And one of the, I think, the really important accomplishments that we've done over the past 100 days is we've been working with the food industry, and we found the food industry very, very receptive. We think we have good science that links almost all of these dyes with ADHD, with neurological injury, with cancer. And they've agreed to phase out the 2 worst of them, which is orange bee and red citrus number 3, within 2 months, and the other 7 dyes within 2 years. And some of the food companies like Tyson's Food have already eliminated them because of our talks. They asked us to do one thing. They said, can we try to fast track the vegetable dye substitutes that we need? And we have fast tracked those, and we've already got them approved. So we have 3 dyes approved this week that are substitute dyes that can be used by the food industry. And we're going to continue to respond to the needs of the food industry. We're going to continue to work with them. And I'm happy to work with you, Congressman.
And I thank you. I thank you for your question and your answer and your response. Mr. Secretary, I wanted to talk with you about this subcommittee's oversight of the 340B drug discount program. I'm a strong supporter of that. I have hospitals in my district. It provides funding to safety net community health centers, hospitals, and other healthcare providers with discounts from prescription drug sales. CHCs and rural hospitals across Tennessee have become dependent upon this program. Just a question, sir. We've heard that this department will move oversight from HRSA to CMS. Can you either confirm or deny that, sir?
I can't because of the court order, but I can tell you, the 340B program, as you know, is it's not a straightforward program because it was originally intended for 100 institutions that were serving very poor communities It's now grown to 27,000 institutions. The patients themselves seldom get the benefits of the drug reduction, and actually 100,000 if you look at all the kind of satellite institutions. But we also recognize that it is the lifeblood of rural hospitals right now. So we can't mess with that program without giving those rural hospitals something else that is going to support them. And we understand that.
Thank you, Mr.
It's,
Secretary.
I can tell you that the drug companies are worried because if we do what President Trump wants, which is, through compliance with the executive order to go to most favored nation, it will lower the price of all drugs, which means it will further lower the cost of 340B drugs, and they consider that existential. So that is a problem that we all need to work out together.
Mr. Pocan.
Thank you, Mr. Chairman, and thank you, Mr. Secretary. I'm Mark Pocan. I represent the 2nd Congressional District in Wisconsin. All are part of 6 counties in South Central Wisconsin. I don't know you, and I think it's important to have a good working relationship with you because of everything that you have. There's a lot of jurisdiction. Now, you've definitely got your hands full with a lot. Some things I think we agree on, and some things I'm not sure if we do. So I'm really trying to explore a little bit of that. I think some things that we agree on, and you brought it up, you want to have a special focus on chronic disease, correct?
Yes.
Yeah, great. And one that maybe Chuck and I disagree a little bit on, but I support what you're doing on ultra processed foods, on food dyes and other junk chemicals, and promoting healthier diets. That's another focus, correct?
Yes.
And also, I think you're supporting and making it easier to access non-pharmaceutical, in other words, natural remedies as part of a person's healthcare decision.
Yes.
And one I didn't have on the list, but I heard you tell Mr. Simpson on dental care. I have a constituent who, because of a infection with a tooth, is now getting Meals on Wheels and his health is destroyed. So I appreciate that as well.
Yes.
So in trying to get to know you, there's some public things that, make you somewhat of a conundrum to people like me, just trying to, understand. One is on vaccines. And I don't want to ask you about, all the specific theories on vaccines, but something that might be helpful is you've previously said you vaccinated your children. Just because I think this is a helpful answer, and this isn't a gotcha, I promise. If you had a child today, would you vaccinate that child for measles?
For measles, probably for measles. What I would say is my opinions about vaccines are irrelevant. I have directed Jay Bhattacharya.
Sure. No, like I said, I don't want to.
So that everybody can make that decision. But I don't want to seem like I'm being evasive.
Yeah.
But I don't think people should be taking medical advice from me.
Right. No, I got that. And I'm not asking you to give them medical advice, but would you vaccinate your child for measles?
If I answer that question directly, that it will seem like I'm giving advice to other people, and I don't want to be doing that. I want people to make.
But that's kind of your jurisdiction because CDC does give advice, right? I'm not trying to do it as a gotcha. I was just
what I think what we're going to try to do is to lay out the pros and cons, the risks and benefits accurately as we understand them.
Okay.
With replicable studies.
Can you talk about chickenpox? Would you vaccinate your child against chickenpox?
The problem is people lazy. They don't want to have to do any research or anything for themselves. They just want somebody to tell them what to do. And they go ahead and do it. And then when it don't work, they got somebody to blame.
Calculate the population for chickenpox, you get shingles in older people, which is more dangerous.
Just one last one, just a yes or no, please, if we could. Polio?
Again, I don't want to be giving advice.
That's fair. No, that's fair. Like I said, I was not doing it as a gotcha. I was just, I thought it could be helpful if. Okay, so let me ask this on the 988 hotline. In your budget, you eliminated, there was a special button you could press for LGBTQ plus youth. I'm an openly gay man. I deal with a lot of organizations that deal with this. The suicide rate among LGBT youth is 4 times nationally the rate of other youth. This is one where I hope that we could try to, like Chuck asked, work together to try to see if we could have a conversation about not eliminating this because unfortunately, because of the bullying that's out there, because of honestly adults bullying, both in Congress and state legislators, these kids are often at unique risk, and having that specific button they can push helps them to be able to get that service. Is that something we could talk about, at least trying to?
I'm happy to talk to you about it. And I love the way that you approach this in a way that rather than attacking me,
No.
is,
Say
reaching
what?
out. And I'd love that
What you
from
want,
other
sir?
Democrats, because I think we have a lot to talk about. As you know, and I like that you
Just because I am short on time.
988
Just wasn't clear. The only thing we heard was
created by President Trump. He
LGBTQ,
believes strongly in it.
all that.
The reason he
if I
believes
can,
remove that button is
Mr.
because we don't
Secretary.
want to isolate
Yeah, I got you.
different demographics and polarize our country. Everybody
Yeah.
on that line is trained in cultural sensitivities.
Sure. I got you.
And-
I just would love to talk to you because I think this is a unique one, and I respect that we can
I'm
have a
happy to talk to
conversation.
you. You can pick up
Last
the
one,
phone.
just because I'm down to 22 seconds. I lost a little
Okay.
time there. Medicare Advantage. I know the Trump administration is going after waste, fraud, and abuse. This is a program we get a lot of constituent complaints on. It costs more than Medicare. It was intended to find savings. It doesn't. In fact, I think the current estimate is $80 billion in overpayments have gone to private insurers. Are you committed to, one, going after those overpayments, and two, if Medicare Advantage isn't more cost effective, would we have a conversation about either eliminating the program or making it more effective?
Medicare Advantage. I definitely want to go after the waste, fraud, and abuse in the private sector. There's 30 million people who want Medicare Advantage. I have Medicare Advantage. It works very well for me. I like it.
But it costs more, and that's the point. It does.
I think our administrative costs are still far less than private industry.
But it costs more than Medicare. That's my point. So that's all I was.
But the services are much better.
Okay. Another thing, if we can talk about and continue the
Okay,
conversation,
we're not
I am
gonna
sincere
invest
about
in
wanting
you.
having a
I'm
working
happy to
relationship
talk
with
to you
you,
about
Mr.
it.
Secretary. Thank you.
Thanks.
Appreciate it.
Ms. Bice.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being with us this morning. I first want to address a comment that was made by the ranking member earlier as it relates to getting the president's budget out. Just a reminder that when President Biden was elected, he did not send out his first presidential budget until May 28th of 2021. So giving some grace to a new administration, I think, is warranted. I want to take a minute to highlight the Oklahoma Medical Research Foundation, or for short, OMRF. OMRF was chartered nearly 79 years ago and started out with 18 scientists on staff. They now have more than 475 scientists.
Halo wearing
Which-
Joe? That's what y'all
It's
trying
the
to
Oklahoma
tell me?
Medical Research
Okay.
Foundation, and I've actually given your team some information. Last month, I was proud to attend a ribbon cutting for their new Biomedical Data Sciences Center, which will provide computing and data analysis capabilities to support scientists in researching very important areas, including heart disease, cancer, and autoimmune diseases. This center cements OMRF as a leader in research methods and as a hub for collaboration in my district. It is important that OMRF continue their partnership with HHS in their research to expand life expectancy and healthcare outcomes across the nation. The impact that OMRF has had on Oklahoma and the country is really immeasurable. It ranged from certainly economic impacts to healthcare advancements, community engagement. The positive impacts are endless. And I want to mention them because, I want to make sure that we're investing in the right things. Like you and President Trump, I am focused on reducing the prevalence of chronic diseases. And the discoveries that they have made over the last many years have produced 3 life-changing drugs. Most recently, in 2019, the FDA approved the first targeted therapy to treat sickle cell disease. And this is based on discoveries by OMRF researchers. The point being here, Mr. Secretary, OMRF has been crucial in advancing research and treatment of chronic disease and rare diseases for millions. And they take pride in being one of 7 NIH autoimmune centers of excellence. And I hope you and your team will continue to work with OMRF so they can continue the positive impact in Oklahoma and across the country to make America healthy again. That being said, in order for the U.S. to maintain its lead in biotechnology, we need to ensure that the U.S. continues to be the country of choice for best and brightest in the field. What will HHS do to help attract biotech researchers?
Well, we spend already at this juncture 70% of the research funding in the world on biotech and biomedical research is coming from my agency. And we understand that it's our aspiration that the United States remain the hub of biotechnology around the globe. We need to change some of the FDA policies to make it, to give a faster track for biotechnologies to get approved. We're working on that now. We're trying to reform phase 3 studies, for example, which are the longest, the most expensive to do a lot of those functions by AI. We're phasing out most animal studies at NIH and FDA, which again is a very expensive part of the process. And because we can accomplish a lot of those goals on safety and efficacy with AI technologies. We brought the best AI developers in the country into HHS. Nothing like this has ever happened before. People walking away from billion-dollar concerns to come and work for us, to transform our agency into a central hub for AI on the globe. And a lot of that, those changes are designed to make it easier and faster to get, biotechnology to market.
Perfect. Can you talk a little bit about the changes at NIH in particular? I know that there's been a lot of conversation around that. Certainly streamlining is part of that, but can you talk a little bit more about what your vision is for NIH moving forward?
Well, NIH, when I was a kid, NIH was the premier gold standard scientific institution in the world. Over the years, it was captured by industry and by, I think, a kind of ossification that happened at NIH. Because of the longevity of some of the leadership there. And there was a tremendous amount of corruption. And, part of that corruption is we now have the CIA, the FBI, the Department of Energy, and the Department of State all saying that the COVID-19 pandemic came out of research that was then sent over to China. And that was the end point. We also have the sickest people in the world. NIH, with the best science, is supposed to be protecting. We should be the healthiest people in the world. We're switching the trajectory so that we're going to really focus narrowly on chronic disease, ending the chronic disease epidemic, and then we're going to make sure that the science cannot be corrupted. And every scientific study is replicated. At the raw data for those studies is published. At the peer review for those studies is published. And we're going to focus on making sure that we get to younger scientists rather than the old boys network. And I could talk to you about scientific corruption all day long, about horror stories that we know have happened within NIH. One of those, probably the worst, is the amyloid plaque scandal. For 20 years, because of utter corruption and fraud, we were directing Alzheimer's research to one hypothesis, and any other hypothesis was shut down. We should have the cure for Alzheimer's today. We don't have it purely because of corruption at NIH.
Ms. Frankel.
We are going to have it quickly.
Ms.
Thank you,
Frankel.
Mr.
Thank you, Mr. Thank you. Welcome, Mr. Secretary. Before I ask my questions, I just want to make this statement. Draconian abortion restrictions are killing and maiming women, and that is a tragedy. You don't need to respond to that. I want to thank you for being here. I'm going to try to ask my questions as kindly as possible. Do not take them personally. In the past, I believe.
I won't take your kindness personally.
Okay, well, whatever. What do they say? If you can't take a joke, don't go into politics. So let me start by saying in the past, I have believed very strongly in the mission of the Department of Health and Human Services. Funding this department should be one of our highest priorities because if it's run correctly, it has the power to save lives, advance life-changing research, and protect the health and well-being of our families, especially our most vulnerable, our children, our seniors. But to be straightforward, as my colleagues know, in other words, my, I am deeply wary of giving $1 to this administration under the current leadership, especially because it seems to be a disregard of science and, most importantly, ignoring the body of government that appropriates funding. That's us, the Congress. In just a few short months, we've seen a level of chaos and destruction. I compare it to a tornado hitting a populated community. without the consent of Congress, which appropriated funds with Elon Musk's chainsaw. Medical research has been gutted. Clinical trials have been halted. Billions of research grants have been yanked without warning. Preventative health programs, those that keep people healthy and out of hospitals, have been slashed to the bone. And I'm from Florida, where we have one of the largest senior populations in the country, and I'm particularly alarmed. Alzheimer's, cancer, heart disease, these are not abstract concerns. Research has been stopped. These are everyday fears of millions of Americans, including my own constituents. And so we've seen the firing of thousands of scientists and other professionals. All this to give tax breaks to our healthiest or wealthiest citizens, who are also probably our healthiest citizens. And to me, that is unconscionable and dumb. So this should not be a partisan issue, really, because it doesn't matter what political party you are. People want to and should be healthy, but the Trump administration, ideological dismantling of our public infrastructure, must go in a different direction for me to vote for your budget. Now I have a few questions for you. I think you said that the decision for all these cuts was done by a varied amount of people. Were any of the cuts made before you were sworn into office? Were you handed? Do you remember that? Were people fired before you was? All right. Well, what did you say?
I think so, but I can't tell you.
Okay. Let me ask you this: was any member of Congress or anyone on this committee consulted before the cuts were made? And could you tell me who you talked to here?
I mean, I stayed pretty close touch with Bill Cassidy during.
Okay, well, I'm asking you if anybody here, because you're here.
Here.
You're asking us for money. We appropriated the funds. Did you talk to any of us, Democrat, Republican? You know what? There are actually some very bright Republicans, I will say that, on both sides of the aisle. So the answer to that question is no. So your decisions, were they based on merit or generated by an algorithm? Did somebody get Elon Musk's computer and say,
when did that become a
just
requirement?
make 20% cuts? You know, if that
I mean,
happened?
I disagree with your entire characterization. It
Well,
was like the recitation of a narrative that, everybody knows out there. And it's the Democratic
Well,
Party
I'm
narrative.
just asking you a
But
question.
it's just not true.
But
We
that-
weren't
but-
cutting thousands of scientists.
All right, I'm
We weren't
reclaiming my
cutting
time.
clinical trial. I mean, everything you said was essentially
Okay,
dishonest.
all right, that's my.
And don't take
prerogative, I
that
guess.
personally.
So don't take it personally. Mr. Secretary, how many employees have been let go so far?
Excuse me.
How many employees have been let go so far from your?
About 10,000 left, took the fork in the road, about 10,000 more.
And how many are on administrative leave now, waiting to be fired in June?
Well, that would be the second 10,000.
Okay, so, and are they currently being paid?
Yes.
Yeah, so they're being paid to do nothing.
Well, there's a lot of them are supposed to be coming in still.
But they're coming in to do nothing because they're not allowed to work.
Oh, no, we want them working.
Are you empowered to reverse these decisions?
Yes.
You are, okay. And how was the 15% indirect research cost cap decided?
15%.
Research, there's now a 15%.
That's pretty much about 2 to 3 points above industry standards. So we were just, I mean, if you're the Gates Foundation and you give a scientific grant to Stanford, you're giving them a 10% indirect
So
research.
you base this on the Gates Foundation?
All of the
You're saying-
Rockefeller Foundation,
Right.
all of the other foundations that give to
I'm gonna ask you
biomedical research.
One more question.
You're asking me a question,
You've
but you
done
won't let
ve-
me answer it,
You've
Congressman.
done very well, very, very well. I just want to know, are you going to, can we trust you? If we put money into the budget for you, you're going to spend it the way we've directed it?
Yes, that's
Really?
what the law requires.
Okay, thank you. I yield back.
Mr. Moore.
Thank you, Mr. Chairman, and thank you, Secretary Kennedy, for being here. So yesterday we had good news in West Virginia. I want to thank you and your team for working with the West Virginia delegation and especially my office to bring back NIOSH, the facility in Morgantown. This facility and the programs it administers are absolutely critical to West Virginia and to our nation's coal industry. Mr. Secretary, my understanding is that the 111 employees at NIOSH in Morgantown were reinstated earlier this week. Is that correct?
Yeah, I reinstated 328 employees at NIOSH. About a little over a third of them were in Morgantown, and then about a third in Cincinnati. And then the World Trade Center group, I also reinstated.
Well, thank you for that. And the Black Lung Screening Program and the Coal Workers Health Surveillance Program are particularly important to West Virginia. My understanding is that the Coal Workers Health Surveillance Program at NIOSH will be fully reinstated. Is that correct?
Yes, the program will continue to function with continuity.
That's great. And thank you for that very much. And Mr. Secretary, it's my understanding that the programs for occupational safety and testing, like the respirator testing programs, will also be fully operational again. Is that accurate?
Yes, that's accurate.
Very good. Well, thank you so much for working with my office on that. As I stated, it's critically important to our coal miners and their safety and the work that they're doing, which is hazardous, but very important to our country. And lastly, I do want to, and see, I'm not going to take a lot of time here, Mr. Chairman. So I do want to thank you for visiting my children's school, their Catholic school there in Martinsburg, West Virginia, with our governor recently. My daughter was there on stage with you, one of my kids, and we had a great announcement there as it relates to food dyes. And thank you for being there and being supportive of us, and also just your generational service to this country. I'd be remiss if I didn't mention my close family friend who passed away just a few years ago, who was your father's campaign manager in the state of West Virginia when he was running for president, who obviously left a huge impact on our state. Thank you for all the work you're doing to make America healthy again. We obviously need the help in West Virginia, and thank you for all the support that you've come into the state, helped us support these programs that we're trying to bring back our folks to a healthy lifestyle and path. Thank you so very much for everything you're doing for this country and for West Virginia.
Thank you, Congressman. I've spent a lot of my career in West Virginia, and my family has deep roots there. My uncle, President Kennedy, would not have been president had it not been for the people of West Virginia. And that primary was the most critical primary, and Wisconsin was the second one in 1960. And he always reminded us of that. And I don't think any member of my family has ever forgotten, and it's a joy for me to be able to spend time in your state.
Well, thank you so much for that. There's a lot of great books written, by the way, on that primary in West Virginia. So thank you so very much, Mr. Secretary.
Ms. Watson-Coleman.
Thank you, Chairman. Mr. Secretary, few things enrage me more than the racist attacks I see this administration carrying out by embarking on an ignorant crusade to rid the government of any programs that are working to improve the lives of Black Americans. The administration has moved to ban the words Black, race, bias, minority, oppression, prejudice, discrimination, disparity, and racism. Any grant application on federal programs that include these words had them immediately stripped. It is painfully clear to me that in doing this administration that you work with and work for is attempting to legitimize racial discrimination, and that, sir, is a moral disgrace. It is not woke to improve the health and well-being of Black people who are disparingly impacted by just about every health issue. It should not be controversial to make right a healthcare system that was not built to help people like me, to take my concerns, my pain, my health very seriously in this country. Black women die from childbirth complications at a higher rate in this country than any other high-income country. And last year, where there was overall maternal deaths dropping in this country, well, Black women maternal deaths rose. This sickens me, and it tells me that our government has so much more that we must do to focus on improving the lives of Black women, not less. Your decision and justifications are damning and troubling. particularly for destructive impacts your choices and benefits will have on poor and minority people. So tell me, sir, how will eliminating minority health offices, how will eliminating initiatives and programs across the department that were created to look at the disparity in healthcare and the need to give greater attention to the fact that Black folks' experience in healthcare was very damaging, was very different. How exactly will HHS, banning the words that we use to describe ourselves, make us healthier?
Congressman, President Trump's vision of this country is the same as Martin Luther King's, that we should have a colorblind administration. President Trump is deeply concerned about the maternal health crisis and the fact that Black mothers are more likely to die in childbirth 2.6 times, 260%
So
more
how will
likely to
you
die.
explain, excuse me, sir, let me claim my time because I don't need this rhetoric about Donald Trump and the lie that he cares about me and Black people. What I want to know is the
I was answering your
proposals.
question,
I'm claiming
Congresswoman.
my time, sir, reclaiming it. I want to know specifically, how do you intend to address those disparities and to overcome those disparities as it relates to Black health in this country with the changes that you've decided are important or someone has decided for you? I don't know, with your department. Specifically, sir.
I've spent a lifetime working on those priorities and I continue to do so. We have 8 divisions, 8 programs for minority health at HHS. We've
That's
closed
amazing.
one of those offices. We're maintaining the other 7. We have 42 programs for maternal health. We're going to close a couple of them and consolidate them. We're going to still spend $1.7 billion a year. The commitment is there. We're
you,
just
sir.
reorganizing.
Okay, you know what?
And
The impact of reorganization is something that I shall continually ask you to show me. So please let me warn you now.
I welcome those
And
inquiries.
I don't want rhetoric. I want numbers. The other thing that really troubles me, sir, is LIHEAP. It is a program specifically to address the needs of low income
Oh, this
and
has
minority families
much.
as it relates to heating and even air conditioning. Why? And what is your rationale for eliminating that program specifically? Why?
I'm very
What?
committed to LIHEAP. My brother ran a low.
I don't care about your past. I care about your functioning in this department, in this administration
See?
right now in response to this question.
My time has expired.
Oh, well, then so has your legitimacy. I yield back.
Mm.
Mr. Secretary, thank you.
What was the
for
point of
being
all
with
of that
us.
again?
And I don't know if you want to follow up on any of that, but
I'd be happy to.
okay, feel free.
As I was saying, I'm very conscious of the importance
ain't
of
nobody
LIHEAP
reading. This too much.
to poor people all across this country. My brother ran a low-cost nonprofit fuel company for most of his life that provides low-cost fuel to people in New England. I've had many people come up to me and said my life was saved because of that. I talked to Bo Nigrin, who's the president of the Navajo Nation, when I visited about 3 months ago, and he said cuts to LIHEAP will end up in killing people. So I understand the importance of this. I think OMB's rationale was that President Trump's energy policy is going to reduce dramatically the cost of energy in this country. And if that happens, then LIHEAP is just another subsidy to the
brother over
oil
here
industry.
in the blue tie,
If it
sitting like
doesn't
he's
happen,
scared to
then
move.
Congress
Like if
is
he moves, the whole
welcome,
spot
and
gonna
they
blow up.
should
What is happening?
appropriate the money for LIHEAP, and I will spend it. I already allocated $400 million from LIHEAP during the last 100 days, and I will continue to do that and get that funding to the people who need it in this country if the fuel costs do not go down.
Thank you for that reassurance. Mr. Chairman, I want to submit an article for the record here a minute, and I'll refer to it. But last month, the National Security Commission on Emerging Biotechnology concluded in its report to Congress that the Chinese Communist Party seeks to dominate the global biotechnology industry so that other countries, including the United States, are dependent on the channels it controls. China is already deeply embedded in the United States' critical biotechnology supply chains, including those for life-saving medicines. And as you know, Secretary, China has a history of weaponizing supply chain dependencies for critical goods and medicines against countries. For example, in March 2020, following the arrival of COVID-19 from China onto the American homeland, the CCP's mouthpiece, Xinhua News, published a commentary proposing to throw the United States into a sea of coronavirus. And that's what I'd like to submit for the record, Mr. Chairman. I request unanimous consent. Would you agree, Mr. Secretary, that overt reliance on the CCP and the U.S. biotech and health ecosystem poses a threat, and that we should be developing independent supply chains to protect the health and well-being of Americans so that we reduce our reliance on China for critical medicines and their active pharmaceutical ingredients?
Yeah, absolutely. And this is a priority for me and for this administration. China does not spend its biomedical research money on DEI or on other issues. They're directly and narrowly focused on creating dominance across the globe. We saw the problem with supply chain control by the Chinese during COVID. And also, the Chinese have a specific program called the 1,000 Talents Program. It is designed to steal U.S. IP and technology, and we have facilitated that at NIH by funding Chinese scientists with contracts that don't require them even to report their science back to our country, but they give it directly to Chinese military scientists on bioweapons research that we gave them the technology for. This is how out of control NIH was under my predecessors. We are working very, very hard and successfully to bring production home. I've met repeatedly with Eli Lilly, which is now building 9 facilities, 9 factories in this country, including for essential medicines, the ingredients, essential ingredients for those medicines. We are regularly meeting with all the other pharmaceutical CEOs, and we've told them this is our priority. We want to produce all the parts, all the essential medicines here in the United States. And we have already launched a program to do that, and it's already very, very successful.
Thank you, Mr. Secretary. And then on the issue of medical countermeasures, I wondered if you could talk about challenges facing BARDA, the Strategic National Stockpile, and how Congress can help you overcome any challenges in that arena.
We have, BARDA, we are redirecting BARDA so that it's going to do gold standard research. BARDA has been very successful in the past. It produced over, I think, 103 FDA licensed drugs or protocols or medical devices for national emergencies. We run the national stockpile, which has $17 billion worth of supplies. Some of those supplies are misaligned, and we need to do a better job, and we're going to do that at NIH to make sure we are prepared for all emergencies, including radiological, chemical, and biological emergencies. And I would love to work with you, Congressman, on helping us to achieve those goals.
Wonderful. And then finally, a couple of things. One is I want to compliment you on your commitment to public service and the way you've responded with grace towards people who have opposed some of your political views, including some of your family members, and I've kind of followed that. I want to really highlight the fact that your Make America Healthy Again has really put this in the spotlight in these chronic diseases, and especially starting with children. And nutrition, healthy lifestyles. I know our community health centers in my district, which is a rural district, want to work with you on those goals. What can we do to promote this with young children, healthy lunches, all sorts of areas where local communities can partner with you in this effort?
We are about to reissue the dietary guidelines. And we're going to do it very quickly. We have until January, but we're going to do it. I think we'll have it done even before August. And we took the Biden guidelines, which were 453 pages long and were clearly written by industry, that are incomprehensible, driven by the same industry capture and those kind of carnal impulses that put Fruit Loops at the top of the food pyramid. And we are changing that. So we're going to have 4-page dietary guidelines that tell people essentially eat whole food, eat the food that's good for you. That's going to drive changes in the school lunch programs. And we're going to need your help to make sure we can get good school lunches to Head Start. I've been touring these Head Start facilities. Everything they eat is in a package, and it is just loaded with sugar and with chemicals. We're poisoning this generation, 800,000 kids, the poorest kids in our country, and we're starting them out with this count against them, with diabetes, pre-diabetes. 38% of our youth now are diabetic or pre-diabetic. That was 0 when I was a kid. When anybody thinks that we did gold standard medicine in this country from these institutions, look at our children. They're the sickest children in the world. Laura, you say that excuse me, Congressman DeLauro, you say that you've worked for 20 years on getting food dye out. Give me credit. I got it out in 100 days. All right, so let's work together and do something that we all believe in, which is have healthy kids in our country, for God's sake.
Ms.
Do
Dean.
that together. There's no such thing as Republican children or Democratic children. There's just kids, and we should all be concerned with them.
Thank you, Mr. Secretary.
Ms. Dean.
Mr. Secretary, Madeline Dean, suburban Philadelphia. Thank you for being here. I want to read the very first sentence of your written testimony, which you have submitted. The mission of the Department of Health and Human Services, HHS, is to enhance and protect the health and well-being of the American people. And we are here to analyze the 2026 budget request, as the chairman points out. But I also want to take a look at what the ranking member has taken a look at, which is the cuts going on right now to that which has already been appropriated. We have to really keep a clear line here between what's your proposal for 26 and what is going on right now against the legislation that we have passed and that has been signed into law. I have to tell you that I'm more interested in substance than slogans. I'm getting a little lost in the MAGA, the MAHA. Now there's AHA. I don't know where we're going with this. I want to talk about the substance. And in this case, something very personal to me is the issue of addiction and mental health. And I know you care deeply about these issues. I know you have been honest about your own recovery, your own struggle with addiction. In my family, my middle son, Harry, is now 12 and a half years in recovery from opioid.
How the hell you lost in the MAGA
and
and MAGA ain't
it
even up here
hard
talking?
road. In active addiction, you know how difficult it is, and it's difficult to bring a family member back. I give Harry great credit. He now works in the area of addiction. That's why I'm very, very worried about what is going on with SAMHSA. If you take a look at the data, the numbers, we were getting somewhere. 2 years ago, 3 years ago, we were losing 110,000 people a year to overdose. That's 300 people a day. I call that a jetliner a day of souls crashing to this country. Just last year, the second half of 23 and the first half of 24, 12 months, that number went down 27% to 81,000 deaths of overdose. Don't let me minimize 81,000 deaths. That's still 220 people a day. Today, tomorrow, yesterday.
Well, you know who wasn't
365
president
days
3
a
years
year.
ago?
But a 27% reduction in overdose deaths in this country. Overdose is still stealing a generation in this country. So why in God's name are we shuttering SAMHSA?
Well, ain't that all under the
We are
same
not
administration?
shuttering
That's what we're
SAMHSA.
saying.
I share your concerns, and I'm anxious to work with you on this problem. I'm fully committed to it. Because of my own history, I lost a brother to overdose. I lost one of my nieces during the pandemic to overdose. Like every family in this country has somebody that was lost. As you point out, we were losing, I think 3 years ago, 106,000 American kids. It's double the number that we lost during the 20-year Vietnam War. And we ought to be applying the
Why
same
the cuts to
resources.
SAMHSA? And why are you
We
shifting?
are not
you've already
shuttering
cut.
SAMHSA. We are still running 500 addiction centers.
You've already
across-
cut SAMHSA, and the budget proposal is to shutter it and shift it to an AHA program, which I don't know what AHA means.
To shift it to the Administration for Healthy America. We're shifting a
is
lot
that-
of the chronic disease programs out of CDC into a center that will address chronic.
And you and I
disease.
agree that addiction is overdose is a public health epidemic in this country.
Yes.
Then why would we, when we are finally seeing some success?
Well, if you know it's being
bury
shifted,
that
then why don't you
success,
just look up
put
and
it
see
in
what
a
that
AHA
is?
program,
Why we
which,
doing
by the
this,
way,
ma'am?
logically doesn't make
Information's
any
there.
sense. We have to now
Playing games.
rehire people and figure out what their roles will be within AHA. Why wouldn't we analyze the data that shows we just saved 20
That's a
plus
choice. We can't
thousand
call that public
lives
health.
in the course
That's a
of 1
choice you as
year?
an individual
This
maker.
matters in my district. I have buried way too many kids to overdose, to fentanyl poisoning, by the way. You don't have to be an addict. You can just be poisoned by fentanyl. Why in God's name are this administration wants to shutter it? We know that, and shift it into AHA.
Maybe he did.
Why
and was
would
like,
you
you
do
know
that?
what? It makes more
They wanna
sense for them
shut it.
for
What we
us to
wanna
put this
do
group
is we
over
wanna
there.
Shift that function into a place where we're going to be able to administrate it more efficiently.
Well,
and
y'all need to
that's
be looking
all.
at their parents.
What
'Cause
analysis
it's a
was
lot of
done?
us
Can
who
you
manage
show us
not
the
to
study
OD.
that led you to the decision? Shutter SAMHSA, shift it. We call that shift and shaft in my old days as an appropriator in Pennsylvania. Shift it over here, throw it in a block grant program, and good luck. What's the analysis that you did that said whatever SAMHSA was doing with harm reduction, by the way, with making naloxone available, with training for naloxone? I literally carry this with me every day. I want to normalize the life-saving capacity of naloxone, and you guys want to bury it in AHA.
Oh, we want to provide naloxone, Narcan. We want to make sure that addicts
But
have
you're-
every option.
You're eliminating the training for that.
Suboxone to methadone and to
Medicated
12-step programs to inpatient, outpatient.
Oh,
You're
so
you're
We run
zeroing
500
them
let's
out.
get this
We run
straight. You're,
500
the
addiction
reduction
centers.
in
We're not
ODs
gonna
went
stop
down,
doing
not
that.
because they
My
stopped doing
agency
drugs.
used to do
It's
it.
because we created something
you
that
looking
to
at-
keep them
It's
alive.
shifting
We gonna
to
stop
a
this.
subdivision where we can operate it more efficiently with other chronic diseases.
But do you realize that
EDC is going to do infectious disease, which is why we created it. It had mission creep and it was operating with
mission
not-
creep as it was saving lives?
Mission
Mr.
creep.
Secretary, I beg of you, talk to these families. You know these families. You are these families. Help us save more lives. Don't shift it and shaft it.
Mr. Clyde.
Thank you, Mr. Chairman, and thank you, Secretary Kennedy, for appearing before our subcommittee today. As we consider the future of Americans' health in the Department of Health and Human Services, I appreciate the opportunity to discuss reforms that prioritize the health of our citizens while restoring transparency, accountability, and constitutional limits on federal power. For too long, federal health policy has been burdened by wasteful spending and ideological agendas, undermining the scientific integrity and public trust. I'm encouraged by this administration's efforts to end the politicization of our health agencies and to bring common sense and accountability back to HHS. I also support the Make America Healthy Again initiative, which addresses the consequences of misguided policies, poor nutrition standards, and harmful medical practices. Americans face record levels of obesity, chronic disease, mental illness, and pharmaceutical dependency. Secretary Kennedy, I commend your leadership in launching a commission to examine the root causes of these crises. But we cannot talk about restoring health without also confronting one of the most horrific scandals of our time, the trafficking and exploitation of children at our southern border, often under the watch of the very agency tasked with protecting them, HHS. The Biden administration dismantled critical safeguards, turning the unaccompanied alien children program into a pipeline for abuse. These are not bureaucratic oversights. They are instances of state-enabled child trafficking, and they must end. I support the president's budget
proposal to eliminate welfare benefits for illegal aliens and refocus the UAC program on its core mission, and that is protecting vulnerable children from trafficking, labor exploitation, and abuse. No taxpayer dollar should fund these horrors, and yet the Biden administration made the federal government the final link in the chain of child trafficking. So I want to ensure the money that we spend on health policy is guided by constitutional principles, rigorous science, and the interests of the American people. So my first question for you is, do you know approximately how many children over the last 4 years have gone missing or remain unaccounted for after being released by HHS? Have you looked into that?
The estimate, Congressman, from the Office of the Inspector General, and it's considered a very low estimate, is 291,000 children missing.
291,000 children.
But the estimate, the actual numbers are probably much higher than that. They could go up to 500,000. And if you look at the grand jury report from Florida, what happened to many of those children is just horrific. My predecessor was deliberately employing a policy of speed over safety. So they waived all of the identification requirements for sponsors. Sponsors were not required to show valid identification. They were never fingerprinted, so we didn't know if they had criminal records. There was no DNA testing, so their claims that they were taking a family member were
dubious at best.
Yeah, they were dubious. And we in Cleveland, one of the according to the grand jury testimony and the grand jury findings in Florida, there are so many episodes. One of them is a man in Cleveland who picked up a 16-year-old girl claiming to be her brother, raped her, impregnated her, put her in a home where she was being regularly raped of all men, and then got a 16-year-old boy who disappeared and went back 2 other times for other children. This was happening again and again. One agency placed 592 children with 120 sponsors. 400 children were shipped to a town where there's a meat packing plant in Kansas. 400 children who, they had to come and claim that the sponsors had to claim that those children lived in that town. And we've seen the fake ID where you have one guy who is photoshopped in with a whole bunch of different children, and he's showing up and picking up at these kids one at a time. The Biden administration knew about it. They saw the same pictures we did, and they did nothing. There's 160,000 help complaints that were never investigated. I've launched now a criminal task force. We've opened up 500 criminal investigations and already brought 80 to court. So we are going to try to do everything we can. We're working with DHS to find these children, but the federal government under the Biden administration became the biggest facilitator for child abuse, probably in the history, certainly in the history of our country.
Well, thank you. I was going to ask you, how are you going to hold these contractors and officials accountable? But I think you answered that question already.
We're already doing fingerprinting on every sponsor. We're doing DNA testing on every sponsor. We're doing income testing on every sponsor. And we're doing valid ID testing. Nobody gets a kid without showing that they are a family member.
Thank you. And I see my time has expired, so I yield back. Thank you for that excellent work.
Thank you, Mr. Clyde. Mr. Harder.
Thank you so much. Secretary Kennedy, I'd like to start by talking about your personal story. You've talked openly about your battle with addiction, and I want to thank you for being so open about talking about your road to recovery. As you know, addiction is a real crisis. Tens of thousands of Americans died this year from overdoses. My community knows this all too well, and all of us have been to far too many funerals. So, Secretary Kennedy, I'd like to start by just grounding us in the reality of what treatment like that actually looks like. As I understand it, you were 15 up until when you entered into an inpatient rehab facility. You credit the care you received there as a turning point. Do you have a sense of approximately how much money your family spent on your addiction treatment?
Well, I spent the money on my addiction treatment, and at that time, rehab was probably like $800 a day. I think today they're much higher than that, many of them.
Yeah, I think that's right. My understanding is that the private rehab facility, like the one that you went to, would cost in today's dollar for that same treatment over $286,000 out of pocket, just for addiction treatment that I think we can all agree, Republican and Democrat, is absolutely necessary to make sure that we're keeping our communities safe. I bring this up because
There are, Congressman, there are many really gold star rehabs that do it for a tiny fraction, like $20,000 to $40,000 a month.
there you go. I bring this up because in my community, the average salary is $40,000. So most folks in my community can't even afford $20,000 or $40,000 per month. And most of the folks in our area rely on public clinics that are mostly financed through Medicaid. About half of my district is on Medicaid. And the recent budget that is being discussed in the House right now would leave 50,000 people in my community without health insurance. So Secretary Kennedy, my question for you is, why do you think that a community like mine doesn't deserve access to that same basic health care provided by Medicaid that you benefited from?
I do believe they are. I do believe, and that is the design of the Medicaid program.
So do you disagree with the cuts that are being proposed for Medicaid right now?
Oh, the cuts to, this is I don't
This
know
man,
if you
71
understand
years
this
old, and we're
or
gonna talk
whether
about
you're
something
just
that back when he
mouthing,
was
the
15.
Democratic talking points. The cuts to Medicaid are for fraud, waste, and
Wow.
abuse. And I'll tell you what that means. It means that because of Doge, we were able to determine, and it's about 8 million people who will be affected. Because of Doge, we were able to determine that there are 1 million people who are claiming Medicaid from multiple states. That's illegal. It's theft. You're not allowed to do that. There are another 1 million people who are collecting both under Obamacare and
Mr. Secretary,
Medicaid.
that has nothing to do with the budget that's
These are
actually
the only
being
cuts that are
proposed
being
in the
made.
House.
These are the only cuts that are being made to Medicaid.
That's not true.
Yes, it is. There are another 1 million illegal aliens. We announced a law yesterday, a rule yesterday, we're not going to pay illegal aliens anymore. And guess what Gavin Newsom did this morning? He said, we're going to take all the illegal aliens off the California Medicaid rolls because the feds aren't paying for them anymore. So the compassion ends.
Secretary, let
when
me
he
let
had
me
to write
focus
the
you
check.
on the actual numbers of the
Last
budget that's
group,
being
the
proposed.
final
Secretary, I
group.
regain my time. I think what you are saying
The
is
final group.
absolutely inaccurate in terms of the 13 million Americans that will lose access to healthcare. Let me tell you, the folks in my district are not actually getting Medicaid in another state. They can't travel to get it in another state. The clinics that are providing that life-saving
Let me
care
tell you
are the last resort for
Let me
folks in
tell
our
you the
area.
last category. Last category is adults who are able-bodied, who refuse to look for a job, to volunteer, to get a job, or to show that they are or to take a part-time job.
I agree with time. That is
those are the
absolutely not true. The vast majority of folks in a community like mine who are on Medicaid are working. They want to work. People want to be able to make sure that
Then
they have
they're in no danger of losing their Medicaid.
That's just not true. We've seen in
Yes, it
time
is.
after time, including in Arkansas and Florida and other states, that when you put
This is a new
more
program.
red tape, yes, but we've seen this chapter before. When you put more red tape in front of people actually getting that life-saving care, you're going to prevent people from accessing health insurance and being able to go see a doctor.
Medicaid is for poor children. It's for women, for mothers, and it's for the disabled.
It is. And
It was-
13 million of those people are going to lose health insurance if this budget becomes law.
They're already losing their health insurance because of all the able-bodied people who are not looking for jobs on Medicaid.
Secretary, I'll just close by saying this. I hope that you remember the grace that was given to you during your darkest days. And I recommend that you come to a district like mine and stare at a single mom who has young kids, who's at risk of losing her health insurance because
Where
of
is
more
your
red
district,
tape.
Congressman?
Stockton, California. Come on out. We'd love to have you. And I hope that you can actually explain why this program is going to make her life healthier and help with the actual outcomes that we're talking about, because I think that's a hard case to make.
Dr. Harris.
Thank you very much. Mr. Secretary, you're absolutely right. No pregnant woman or single mom who qualifies under traditional Medicare Medicaid is going to lose anything. This talking point is ridiculous. The million people who are committing absolute illegal fraud by being on Medicaid rolls in 2 separate states is a fraud, and the insurance companies make a ton of money from it. You're absolutely right. We have a $2 trillion deficit. It's not sustainable, period. There are a lot of things I'd love to do. Believe me, you appreciate it. $2 trillion deficit is not sustainable. You're right. A lot of what you're doing is going back to pre-COVID levels. As a famous person on the other side of the aisle once said, you never want a serious crisis to go to waste, and they didn't let COVID go to waste. We increased federal spending by 40% since after COVID. COVID is over. Let's go back to the old one. We have to look at every program. Let me talk to you. We talked when we spoke a couple days ago about nutrition. Look, I'm 1,000% behind you on nutrition. First, we have to agree that there's a problem. First thing is we can't get agreement that this country is sicker, not healthier. When I proposed that to the last director of NIH, there are arguments from the other side that that's not true. It's absolutely true. By every measure you can, let's take life expectancy. The simplest measure, simplest, easy to understand measure, life expectancy is going down. Let's look at the chronic disease, which you're absolutely right. Whether you look at obesity, overweight, hypertension, cardiovascular disease, they're all gotten worse, not better, and almost all can be linked to nutrition. So I'm glad that you and the Secretary of Agriculture are going to support finally taking the Supplemental Nutrition Assistance Program and put some meaning in the word nutrition. Let me talk a little bit about the NIH, because I think one of the most telling things about the NIH, which some people say should be called the National Institute of Disease, not National Institute of Health, because we study disease, but we're not keeping people healthier. When I wanted to hold a hearing, with my other hat as the Ag Subcommittee Chair, we called over to NIH to get an expert on nutrition. This should be pretty easy, right? You've probably got 1 million of them, right? No, they couldn't send someone over. Now, if I had asked for an oncologist, they could have sent dozens. They would have sent the director of the division. They would have sent the director of the NIH over. And yet it's pretty clear, and you understand this, nutrition is linked to cancer too. Might need fewer oncologists if we had some better nutrition. And God bless you in what you're trying to do with that. That study out of WashU in December that actually shows the link with high intake of fructose to the carcinogen, the lipid, and the lysophosphatidylcholines that are metabolized by humans from fructose that increase tumor growth. I mean, these are the kind of things we should be studying, linking it back to nutrition. So I will just ask you, what are when you envision what we're going to do on nutrition writ large to try to make us a healthier country, what do you think we have to look at? What are the first things we have to look at?
I mean, and that's a really good question, Congressman. What we need to be doing is NIH has done really good. And I talked to Congresswoman DeLauro last night. And she said, okay, NIH has done all this great science so that we can cure cancers faster. And so my question is it a great thing that you can now cure or treat colorectal cancer so only 50% rather than 100% of people die? Or should somebody be thinking about why are we getting colorectal cancer in children, which has never in the history of humanity happened before? It's now an epidemic. There was nobody at NIH to answer those questions. Nobody. No research was done on it. The etiology of all these chronic diseases were just buried because they didn't want to offend the large industries who are putting these poisons in our food and putting them in our pharmaceutical products. For some of these ingredients, we just need to let the public know and probably do labeling so that people can make their own choice. If you want to eat a Twinkie, if you want to drink a Coca-Cola, you should be able to do that. We're a free country. You ought to know that it may increase your cancer risk and that it may increase your risk for diabetes. And so we're going to study each of these ingredients, starting with the most common ones, the greatest, the suspected culprits. And we're going to tell them ones that are so bad they should be taken away. We're going to work with industry to get rid of them.
Great idea. And
The other ones,
I
we're
would-
just going to tell people so they can make an
I
informed
would
choice.
urge that, if we add money back into the NIH budget, we should actually insist that it be nutrition spending. The only last thing I'll say, just very briefly, Mr. Chairman, is that, again, wearing my other hat from the ag side, is that our farmers are worried that if we look at pesticides, as we should, that we just be careful that we work together to make sure that we don't cripple our agriculture economy. And I look forward to working with you on that. I yield back.
I mean, we cannot make America healthy again without the partnership of the American farmers. We cannot be putting them out of business. And they're already operating on razor-thin margins.
Mr. Elzey.
Thank you, Mr. Chairman. Thank you for being here, Mr. Secretary. I was a 20-year Navy veteran, and I'm both a warrior and a father, so I'm also a protector. And 4 years ago, I went down to the border of Texas when the mass wave of humanity came in from South and Central America, and went down with the Texas Department of Public Safety and stood right on the edge of the water at the river there. And I watched a coyote bring a family, a so-called family, across the water. I was powerless to do anything, although, for my own self-protection, I was armed and certainly wanted to take action on this man that was trafficking in human beings. His family came across, at least I thought it was a family, man and wife and 2 children. One of the kids didn't get out of the boat. And the Border Patrol or the Texas DPS trooper says, "You forgot one." Now, why was this happening? It was because they were allowing families to come in undocumented if they brought someone in under the age of 8. I'm not going to relitigate the last 4 years. It's irrelevant at this point. All we've got now is 300 children, 300,000 children that we know of, probably double that because you can't count ones that you don't encounter. Missing in the United States of America, and evil exists in the world. And it exists in the realm of human trafficking and child sex trade, and they're in this country. And so that was the Department of HHS, that was their responsibility to make sure that the sponsors were vetted. They didn't do so. We've addressed what you're doing now. What is out there? What capabilities do you have in coordination with other agencies to try to find these kids?
We don't actually have at HHS enforcement capability. What we're doing is unprecedented, which is we're doing data sharing, and we have a war room where we are doing everything we can to locate these children. And then we, when we get close to locating them, we turn that information over to ICE and to DHS. And they have the capacity, enforcement capacity to actually find them. But we work together with them, and we've got an extraordinary team in our war room in my building at HHS that is working 10-hour days to track down every single one of these kids and try to bring them back. A lot of them, it's going to be very, very difficult.
It sure is. I'm glad you're doing that because, you can't just forget them. We've got a lot of big issues facing child health, but the idea that some of these kids just got handed over to people that we don't know and that they disappeared. And I remember being down on the border. I don't know what these folks did with this little girl. I have an idea, but I know we were finding them dead in ditches. And so I'm glad that HHS is working with other agencies to do that. And as it's police week, I guarantee everybody on this mall this week is willing to help out in any way they can to find these kids. And I'd just like to follow up with, I've watched, and you talked about lunches and how kids aren't being fed very well in processed foods. And I remember growing up in Perryton, Texas, and my favorite people in school, because I hated school, was the lunch ladies. And they made the best food ever. And it was home cooked meals. And I knew it was healthy because they weren't giving us sugary stuff. They were giving us home cooked meals. And I went to lunch with my son a couple years ago, and everything they had was highly processed, frozen, and then heated up. And it was inedible. And so I would love to see the federal government get out of making sure that everybody eats the same thing, because we talked about the tribes too. Tribes can't eat the same thing everybody else does.
Oh.
So I want to go back to local control on figuring out what is best for the local kids in those schools, and then they cook those meals. and get the federal government out of determining what's good and what's edible and what's not. So
Yeah.
I appreciate you.
I'm 100% on board. I mean, we have a research capacity at FDA to give categories of food and, very simple, basic, don't eat anything that comes in a package, don't eat anything that's, with chemicals on it that you can't read, don't eat anything with more than 3 ingredients in it. And sending that out and letting people solve the issue of what exactly makes sense in their locality.
Yes, sir. Thank you for your time. I yield back.
Ms. Litlow.
Thank you, Mr. Chairman, and thank you so much, Secretary Kennedy, for being here with us today. And I'm so grateful for your efforts to make sure our federal health system is laser focused on creating a healthier, more prosperous America. And my home state of Louisiana has embraced the MAHA movement, including a lot of concerned mamas out there. I'm one of them. And I'm so eager to hear from you on how we can best support your mission moving forward. And I'd love to talk about how we can work together to improve women's health research. As a woman, a mother, a member of Congress, I am deeply concerned about the longstanding gaps in research and care that affects women's health. I hear from women daily about how a simple blood test or routine screening could have prevented debilitating cancers, stillbirths, preventable diseases, and the high price tag that comes with the treatments for these diseases. In just my state this year, we can expect close to 30,000 new incidences of cancer, including 4,230 new incidences of breast cancer and 210 new incidences of cervical cancer. Louisiana's 5th congressional district already sits higher than the national average for breast cancer deaths. Yet women are still underrepresented in clinical trials. The unique biological health factors that impact women's health are too often an afterthought rather than a priority. We've made some progress with programs such as the CDC's National Breast and Cervical Cancer Early Detection Program, which has provided access to life-saving prevention and early detection services for women in underserved areas, and the Pregnant Women and Lactating Women Advisory Committee to address this gap in clinical research. But I know more work can be done. Secretary Kennedy, what specific actions will the department be taking to build on these existing programs and ensure that research funding, policy direction, and implementation reflect the full scope of women's health needs?
Yeah, I want to thank you, Congresswoman, and also take note of a fact that there was one of the canards that has been widely reported in the mainstream Democratic Party press is that we terminated a 30-year women's health study at NIH, which was reported initially in the New York Times. The report was inaccurate, really badly inaccurate. We very strongly support that. Jay Bhattacharya, who is the director of NIH, actually has done a lot of his research on that database, and we are going to continue that. We have 42 maternal health programs throughout the agencies. We're going to continue that commitment. That's a multi-billion-dollar commitment, and we're going to continue that. And I'd love to work with you directly to figure out, what we can do more to make sure that that we have great detection, that we have great diagnosis, early detection, and prevention.
Thank you. I look forward to working with you on that. I also represent a largely rural district that covers 21 parishes in Louisiana, many of which are considered medical deserts. I hear from my constituents daily about the lack of access to regular and specialized care. My district is part of the Delta region along the Mississippi River, and within the Delta, there are a number of types of cancers and chronic illnesses on the rise, and there seems to be little success in slowing the morbidity rates down. The 5th district also ranks worse than the national average in cardiovascular disease deaths, kidney disease, and diabetes deaths. This is only one part of the long history of the Delta region having poorer health outcomes than the rest of the nation. Secretary Kennedy, what initiatives are the agency planning to implement to improve health outcomes in the Delta region? And how can Congress partner with you to ensure that these plans come to fruition for our rural healthcare deserts?
Congressman, this is a priority for me during this administration, and I made that commitment to many of the senators who voted for my confirmation. It was probably the most commonly repeated concern about rural health and the decline in opportunities in rural health. We have programs at HRSA to increase personnel and frontline responders and frontline treatment personnel in those districts, which is there are chronic shortages of doctors and nurses who want to move to those areas. We are going to make sure to continue to support rural hospitals and healthcare centers. We are going to dramatically revolutionize the availability of telehealth and AI so that people can avoid emergency rooms by getting treated at home. I looked at a technology yesterday that can accurately diagnose strep throat by telephone using your telephone camera, with taking one picture of the inside of your throat, and the accuracy of that test is greater than a strep swab. And these are opportunities so you can prevent somebody from having to go to the emergency room, and you could get them a prescription on site. There's so many opportunities that are so exciting.
Yes.
And we have just the right team in place to implement them and deploy them across the country. Dr. Oz, and we have Chris Klum, who is, came out of the tech industry, who is integrating AI into all of our systems there. We're really going to revolutionize this agency.
That's wonderful news. My time's expired. Thank you so much.
Thank you, Ms. Letlow. And I think we've covered all the every member has got a chance to ask a question. But before we do adjourn, I would like to recognize the ranking member, Ms. Laura, for any closing comments.
Thank you very much, Mr. Chairman. And first, I would like to, on Congresswoman Dean's behalf, enter an article into the record.
Thank you, Ranking Member. I wanted to enter an article into the record on the topic of Medicaid and work. It is by the Kaiser Family Foundation. It is dated February the 4th. I believe you have it at the desk. Understanding the intersection of Medicaid and work. Unlike the chestnut, the bigoted chestnut that we see very often written that Medicaid recipients are not working, the data shows the vast majority of able-bodied people are working.
Without objection, it'll be included.
Thank you.
Mr. Law.
Thank you very much. Sorry, Ms. Letlow left, but I think it's important to note that in the 2026 budget and under CDC, the breast and cervical cancer program has been eliminated. I think that's important to understand for women's health. Also, Secretary Kennedy, you committed to following the law and awarding congressionally appropriated funds in 2025. And please understand that we are in 2025 and we are under the continuing resolution, which is the 2024 budget. So quite frankly, it should be an easy transfer to 2024 to 2025. But that is what is operative. That is the law of the land, not a suggestion, not a directive, a law of the land. But the evidence suggests that you are cutting billions of dollars in funding right now. The evidence shows that you are withholding at least $2.7 billion in life-saving NIH research, and that is only midway through 2025. And based on the evidence, I believe, and the OMB director has indicated, that you are going to illegally impound billions of dollars of congressionally appropriated funding for NIH research in 2025. To make matters worse, you are proposing to cut NIH funding by $20 billion in 2026. You do not have the authority to do what you are doing. Congressman Hoyer pointed out that very clearly and explicitly. You don't have the authority. This administration does not have this authority. You're reorganizing of the NIH. You don't have the authority. That is in the jurisdiction of the United States Congress. You want to eliminate 5 agencies. You want to create a new agency. Once again, I don't mean to be repetitive, but I do mean to be repetitive. You do not have the authority to do any of that. A couple of other areas I think are important. HHS makes medical decisions every day. You're making medical decisions every day. You're the secretary of HHS. You have tremendous power over health policy. Really horrified that you will not encourage families to vaccinate their children, measles, chickenpox, polio. Vaccines are one of the foundations of public health. Vaccines, yes, save lives. And the fact that the Secretary of Health and Human Services refuses to encourage children to be vaccinated is a tragedy. And we have already had 2 children in the United States who've died needlessly from measles. Let me also move forward. You talked about the NIH and the science at the NIH. And just very, very quickly, high-profile successes from NIH research: Human Genome Project, immunotherapy, CRISPR gene editing, sickle cell cure, vaccines for HPV, hepatitis, mRNA vaccines, including the life-saving COVID vaccines, artificial heart valves, GLP-1 medications for diabetes and weight management. It is one can look at and see what works or doesn't work, but you can't sit here and tell us that NIH has been a failure and that the science and the people who have worked at the NIH have not made unbelievable discoveries to cure. I have a question which had to do with NIH. And you don't have to answer this question, but I don't understand why Republicans get to call you to spare offices like NIH. Who do Democrats have to call? Is there a special phone number if I want to save tobacco prevention, lead poisoning? 9 million children were lead poisoned in Flint, Michigan. 9 million kids, okay? So tobacco prevention, lead poisoning, oral health. Who do we have to call to be able to get those things reinstated? And finally, let me just say this to you, because there's been a discussion here. Well, on nutrition, I would just say to you that, look, I'm very, very big on nutrition, food safety. I've spent, the last 20 or 25 years dealing with this issue. So I'm supportive of some of the areas that you have talked about. And by the way, the Office of Research at the NIH, they can only spend $1 million on research. This committee can provide them with a hell of a lot more money if we want them to do more on research. But and a side issue on Medicaid with regard to young children, it is children, disabled, low-wage workers, and seniors who are the beneficiaries of Medicaid. And that would appear to be really on the chopping block. Mr. Chairman, I have just one more comment to make to you. The testimony with regard to unaccompanied children, spent a lot of time on that issue, a lot of time. Because by law, as you know, we have to accept unaccompanied kids. That's HHS responsibility. You're right, there is an enforcement, but we have that responsibility to keep them safe, put them in the best set of circumstances. I was chair of this committee during the first Trump administration. Still outraged. I was horrified at the time to learn that Stephen Miller was directing border agents to separate children from their parents as a deterrent to coming to the United States. Some of these children were taken away from their parents. They were less than 5 years old. Now, there was about 4,600 kids separated from their families. Today, that was in 2017, 2018. I had a conversation with Secretary Azar at the time. It was in my home, in my office, with my grandson on my lap. And I said to him, do you have a list of the families and a list of the children so that they can be reinstated? He assured me that they did. Mr. Secretary, it's 2025. 1,300 of those children are unaccounted for. Do we want to look for missing kids to get them to their parents? Let's start there. That was a tragedy of great proportions inflicted by the United States of America. You have an unbelievable job. You have, when we talk about HHS, it really is a cornerstone of what this country is all about and what we can do. We don't deal here with airplanes, with roads or bridges or helicopters. That's not what we do. But our job and your job is to save lives. And I would hope that you would take another look at what is being proposed. And I would say, fight back, as I would ask my colleagues to fight back and say, we can't do this. We can't eliminate some of these programs. The havoc that we are going to cause in dealing with research and cutting back on research is going to put lives at risk. You have an incredibly important job.
Thank you,
I
Mr.
think you
Laurel.
can make the difference.
Thank you.
Please do.
Thank you. Well, thank you, Mr. Secretary, for being here today. And let me say, I do think you bring fresh eyes. I think you bring a new perspective on public health and the overall state of our healthcare system in America. And I appreciate what you're doing to look at what is working and what is not working. And I think that's what's very much needed in this, and not take everything as a status quo. And so I think we've had a very good hearing, had a very spirited hearing today, but I think we've covered a lot of topics, and very happy that all the members got a chance to ask questions. We would like, I'm sure we could go on for a couple more hours. And I'd love to do a second round, but I know that you have another hearing. I think you're scheduled this afternoon for, and so you can take a break for a minute, maybe get some lunch, a healthy lunch.
Mr. Chairman, will you yield for a question?
He has got another hearing to go to, so I'm gonna go
I didn't
with
ask him
that.
to yield.
With that, we
wanted
stand
you to yield.
adjourned.
Thank you.
Assisting in the field is additional assigned readings, classroom instruction, and it concludes with a series of competency tests that must be passed before you are assigned your own casework.
Now, when you're working for the crime scene services section, how are assignments or how are you assigned to a particular case or investigation?
As cases come in, if you're on
Child, literally all of that. And I mean, the man basically said the same thing that he has said the entire time he's been on. I don't understand why we looking for miracles from this man in less than 100 days. And Granny with the purple hair, I'm not a fan, because she came on with way too much angst this early in the morning with absolutely nothing to say. Literally, it's the same thing. If we have had these programs and these departments and all this good stuff in place for all these decades, and we still facing the same health issues and the same health crisis, then clearly they're not working. So if they're not working, then we need to try something different. And I said it earlier in the stream, I'm gonna say it again. If you can't figure out that smoking is not good for you, and you can't figure out how not to acquire HIV, then I don't know what to tell you, but that's not our fault. That's on you. Because it is thank you for subscribing, Shane. I appreciate it. It's way too much information out here for you to be ignorant on these facts. You don't need the government to come tell you, oh, you might not want to do this. You might want to go down this road. Dang, Draco, you seen homeless dressed better than her? I'm just saying, it don't take all of this. This is some foolishness. We have libraries, we have the internet, we have social media, we have, you know what I'm saying, people you come in daily contact with. There are a gazillion ways to get information if you truly want it. Like, let's be for real. Because I knew how not to get HIV before I even knew what HIV was. I'm just saying. Like, let's be for real. So, all of that what she was talking about was real pointless. And and sister girl who was up there with all that extra with the, you know what I'm saying, what are we doing, you know what I'm saying, for the low income, and what are we gonna do about the disparities with disparities, you know, black people and their health. Okay, as a black person, I'm gonna be real honest and tell the truth here. We do not, as a collective, as a majority, black people, the black community, Negroes, coloreds, whatever you want to call yourself, being in the best of health is not a priority for us. I'm just gonna tell the truth. We do not have the best relationship with food. The majority of us as black people, our relationship with food is horrible. It's horrible. Like, I live in North Carolina. In the city that I live in the last 2 days, there have been 3 murders at the fast food restaurant, at 3 different fast food restaurants in each part of the city. We got people dying over water cups, burnt biscuits, and bad service. People losing their lives. All at the fast food restaurant. But if you was listening to what RFK was talking about and was at home, you know what I'm saying, cooking, I'm not even gonna get into the growing it yourself and all that kind of stuff. Just on a bare bones cooking some decent food, you wouldn't be out at the fast food restaurant to get murdered. I'm just saying. A red run, excuse me, YouTube. Y'all know what I'm saying. It don't take all of this. It don't. It don't take all of this. But you know what I'm saying? This is what we do. This is what we do. And we have we have a horrible relationship with food. So therefore, when you are ingesting, red dye and salt and sugar and all of that on a consistent basis, you are going to have high blood pressure. You're going to have diabetes. You're going to have obesity. You're going to have, strokes. You're going to have all this other different kind of stuff. It's just the truth. What you say? North Carolina got Mickey. Listen, it was an issue. It was an issue at Wendy's one day. It was an issue at and this was the kicker, y'all. It was drama at Chick-fil-A. Now, when y'all ever known it to be problems at Chick-fil-A? We had drama at the Chick-fil-A, and then yesterday afternoon, we had the red rum, the third red rum at the Popeyes. Yeah, child, them happy. So McDonald's will probably be the next one, because I know the last time I went, it was bullet holes in the menu. So they'll probably be the next ones to show out. I'm surprised Burger King, because it's kind of where the closest one to me is. It's not really that's like right where the seedy part of town, you know what I'm saying, is being cleaned up. So it's still kind of some undesirables over there. But I figured out if it was gonna be some red rum, that's where it would be. But it is what it is. But again, if you're not over there, you don't have them problems. What you say, Daphne? The study on salt proves that salt doesn't negatively affect health unless you have chronically low potassium. Salt and fat aren't bad. Yo, it was a whole brawl with shots fired at the Chick-fil-A, Draco. I was not ready for that. Because Chick-fil-A, it supposedly was about bad service. I'm not saying it don't happen, but for where this one was located, I don't see that. Somebody lying. But yeah, so they done broke out and went to shooting. And I messed around and unalive somebody with some strays because they can't get their life in order. But hold on, let's see. I'm still back on this study on salt. Proves that salt doesn't negatively affect your health unless you have chronically low potassium. Okay, salt fat. Funny how we cut fat and salt, added sugar, then obesity. This is true. We did. We cut fat and salt, added sugar, and then obesity and heart health. Yeah. Yeah. Well, yeah, obesity increased, but that heart health is showing up on the decrease. Trust me. Them mall Chick-fil-A's be son. That's a different type of time. That's a whole different type of time. Let me think. North Lake, no Chick-fil-A. Carolina Place. I don't know if Chick-fil-A is still there. I'm trying to think if our malls still have Chick-fil-A. Like the big malls here. I'm trying to think. I know one doesn't. Heart health decline increase. Yeah. Yeah. I'm trying to think. I ain't been in Carolina Place. So I can't tell you whether or not it's still in the South Park. It's still there. So I know at least one we have Chick-fil-A, but like the other, nah. But it's too much. It is too much going on. You got to get the pow-powing. And then and my thing is these folks out here, you know what I'm saying, with the pow-pow, and your aim ain't no good. Because all the people, only in one of these instances was the intended person actually hit with a bullet. The other people, they had nothing to do with what was going on, but they lost their life. Like foolishness. Oh crap, I ain't done this yet. But yeah, child, folks be cutting up around here now. I don't know what it is, but y'all stay away from all of that. Just consider cooking something. That's what I'm saying. Even if you know what I'm saying, I'm not saying you have to come out here and be, you know what I'm saying, Emerald Lagasse or nobody, but I mean, you should at least be able to follow the instructions on, you know what I'm saying, the Stouffer's mac and cheese or the Stouffer's lasagna, and know how to put some broccoli or a salad or something with it. You know what I'm saying? Till you can get your skills up. It's too much YouTube and Instagram, and y'all love TikTok. Hit the TikTok for some cooking info, and get it together. Take a multivitamin. Take a walk. Get some sunshine. Do something. Do something to try to get yourself together. What's your side? Charlotte, just another comment. Yeah, literally, in each direction is like a different side of the city. It is crazy. These folks be in there because you know what I'm saying, they get the mingling from side to side, so you dragging the hood over to the bouginess, and then when bougie got to come to the hood, and then when they're in the middle gotta go to the hood, they be like, "Yeah, I'm glad I don't be over here no more." Like it's just it's a trip. Especially when you going somewhere like the hospital or the to a hospital, because even with the hospitals are kind of like night and day depending on what you got going on. Yeah, Shane, just take a walk, go outside, get some sun, like drink some water, and they ain't talk about tap water neither. You know, Emerald sucks, and I'll never be overcharged again. Listen. Hey. Okay. It could have just been a bad. It could have just been a bad. It could have been an off day. Death Note. Necessarily mean is that he sucked. It could have just been a off day. It happens to the best of us. But yeah, stay away from that tap water. Yeah, stay away from tap water. I mean, at bare minimum, drink a protein shake. What you say? Do you have any idea how far we'd be if Democrats were met? Child, I don't know. Just enjoying some fresh air right now. Yeah, oh, you hit the squirrel. Yeah, because I'm close to the window. And yeah, these squirrels out here having it stopped raining, so they out here, you know what I'm saying, having their best life. And hopefully we can keep with the no rain so that I can go out and get my walk in today without my rain boots and my raincoat. I would love to be able to get that in without all of that today, but we'll see. He was there cooking. He added gold foil to the steak. Was not seasoned well. Best steak I had so far has been home and in Dubai. Again, okay. Okay, Death Note. We get it again. That could just been when you how can I say this without when you are cooking for the palatably challenged, everybody ain't in a good seasoning. Everybody don't know how to season well. A lot of people think because you throw 30 different kinds of seasoning on something that it is seasoned well, when in fact is at this point shit. You don't need 30 different seasonings for anything that you're cooking at any point in time. Especially in equal amounts of all 30. Sometimes less is more. And when you're talking about steak, that is definitely a time when less is more. Trust me. You don't need Heinz 57. You don't need A1. You don't need ketchup. I saw one dude, he put Italian dressing on the steak after it was cooked. Like you don't need all that. You say salt, pepper, and a grill is all you need for good steak. This is what I'm talking about. Maybe a pat of butter if you're into that. But yeah, you don't need 35 different, you know what I'm saying? You don't need to I saw one dude, he actually brined it like a turkey. I was like, I don't think I want that yet. But I mean, you don't need yeah, I've seen Heinz 57, A1, ketchup, Italian dressing. I saw a dude put Catalina on it. Ranch. Yeah, we don't need all that. You don't need all that. You just don't. You just don't. What you say? Come. You know what? Literally, the only use I have for ketchup is hamburgers. Like literally, I don't use a lot of ketchup. Like on my fries, I don't do ketchup. I don't really. If I can find somebody to burn me a hot dog, right, I'll put ketchup on it. But other than that, I really don't use ketchup. What'd you say, man? If you come down to Texas, we got the best steaks, barbecue. Yes, listen, I'm coming. I'm coming. I got an invite. I'm coming down to the Tejas. What you say? He didn't even use salt and pepper, in my opinion. Salt, pepper, garlic, medium rare is the lit. Yeah, I smoke my butter with garlic and thyme and everything. See, okay, that's what I'm talking about. Death Note. That's all you need. Like I'm telling you all this other nonsense. I'm just saying, like. You say you partially agree, but no. The city spots, okay. That whole pan frying the steak. Listen, don't waste your time with that. You addicted. Listen, Shane, I'm bougie when it comes to French fries and water. I don't just cause they're French fries don't mean I'm gonna eat it, and just cause it's water don't mean I'm gonna drink it. Like I'm real picky when it comes to water and French fries. French fries, if I don't make them myself, I need Five Guys. Like Five Guys is the truth. Five Guys, Wingstop, Bojangles. They're my go-tos. They're my three go-tos. Yeah. Five Guys is top notch. And then Wingstop is right behind them. And then I make them myself. Or BurgerFi. BurgerFi fries on it too. But again, all I need is just I don't need ketchup. Do not bring me ketchup. I usually with those, with them four, I usually get like a season. I'll get like the herb seasoning, or you'll say the Parmesan seasoning. Sometimes if I'm at BurgerFi, I may get the aioli. But yeah, we not, even with that, we dipping. We not slathering all across the top of the fries. I need my fries crispy. What you say, Draco? No, Fiji's not one of my favorites. I'll drink it if I have to, but that's not my that ain't one of my go-tos. What you say? Cook with oak wood, it gives nice smoky flavor. Okay. But Draco, yeah. No, my number one is Aquafina. Aquafina. Here in North Carolina, we have LeBlue. Aquafina, LeBlue. Trying to think of commercial stuff. We said shout out to Wing and Curls in Fort Lauderdale, best fries ever. I'm gonna have to check on that when I get down there. But yeah, I'll drink Dasani if I have to, but do not bring me Deer Park. Do not bring me none of that Dasani. Do not bring me what's that other one that be at the Dollar Tree folks be getting that with the mountains on it. I don't want none of that either. Yeah, I don't. And definitely don't bring me no tap water. I can't. My spirit don't rock with that. My spirit don't rock with any of that. I don't know, kind of. Yeah, Aquafina is that's my favorite. Yeah, Aquafina, LeBlue. You said you use hickory and post oak for jerk. I use hickory and pimento wood blended. Okay. Okay. But yeah, I don't. You can't just bring me water and think I'm going to drink. No, I can't. Definitely don't bring me no tap water. Target, what's that? Good and Gather. That's good water. There's a couple other ones, I'll pick up here and there, but like for the most part, yeah, those my go-tos. Oh, Smart Water. You don't like Smart Water? You don't like neither one of them, the blue one or the alkaline, the black one? Matter of fact, I got an alkaline in the refrigerator I need to go get. I was trying to get the rest of this protein shake down. What was 50-cent water? It was good. Oh, I can't think of the name of it. My tap water, good. I have a home filter. Okay, I mean, filter. I'm talking about straight out the tap. No filterization, no nothing. Vitamin water. That was good. Yeah, I don't want it. Yeah, it got to run through some kind of filtration. But yeah, just you turn on the tap and stick the glass up under there. Don't bring me that. Nah, I'm good. But yeah, we got to have some filtration going on. Yeah. Yeah, I'm down for that. But yeah, just that straight. Can't do it. Won't do it. Okay, that is mad. Oh, who sent this? I'm trying to remember. I can't. What's that? Yes, I did drink water from the hose. I did, definitely. I ain't gonna sit here and lie. I did, but hell, that was better than what's coming out the tap now. Literally, if seriously, whatever they're putting in the water here in Charlotte, every okay. So like when I went to Atlanta, right, y'all, I was only gone. Let me see. I was actually gone from my house Friday, Saturday, and Sunday. So we got about 3.5 days of not flushing the toilets, right? I come back and it's a pink ring in the toilets from the water filtration. Like whatever you put it, turn the bottom of no, I'm not drinking that. What you say? I don't like chlorine flavored tap water. I don't. Hell no. I don't. And then they had a thing on the now well water is good. But it's rare that I'm in a position to get well water. I have to go to the country for that. But I might be able to get hold of some this weekend when I go to the Chill Wine Festival. But yeah, they was on the news talking about, you know what I'm saying, don't be alarmed. And they was trying to, you know what I'm saying, trying out some, you know what I'm saying, a new process. And I'm nope. Mm-mm. Nope. 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 So what if you had flowing from Thursday to Monday? Caused a pink ring in the toilet? I don't want to drink none of that. I'm not taking no chances. I hurried up and got the digging in the pulling out my stash. I don't. Not doing it. But yeah, no, that, you know what I'm saying, hose water as a kid, that was us different from what's going on now. Stuff wasn't as bad. Did I find it? Oh, wow. I'm living in the new Flint. They said the same thing and corroded the pipes. Honey, I was like, I ain't doing this. Oh, we are not going to do this. Not going to do it. Ah, there it is. They, you know what I'm saying, have I don't know if it's, you know what I'm saying, the whole city or, you know what I'm saying, just my neighborhood, because they are replacing a lot of the pipes. So like this time last year, they were actually on my street replacing stuff. Now they are like three, let me think, because I went walking. Three, they're three blocks, well, 3 streets over, which is essentially, because one block is long as hell, one block is like 3 blocks. So it's like maybe there'll be 6 blocks over. You say you got well water at your mountain cabin. I'll bring a few gallons back every month. Okay, listen, yeah, that well water's all right. I definitely would, you know, say have access to some when I go tubing. So yeah. It seemed to be good for plants. My plants seem to do better when they have access to well water. But yeah, I ain't even finna be playing around with these folks. I do not drink tap water. Okay. Yeah, I can do that. Absolutely. But yeah, we do not. I'm back to what we were saying. We do not have a good, and the Americans at this point do not have a good relationship with food, because it is far too many. Well, you know what I'm saying. The answer is pull out some oodles and noodles, or we're gonna run through the drive-through, or you're saying hit the DoorDash to get some pizza. Like folks, it's just not it. Rainwater and well water better than that chlorine for plants. Exactly. Exactly. Is that who this is? There you go. Yep, it is. But yeah, we got to do better. Just cook something. I'm telling you, like once you start cooking on a regular basis, it does not take that long. I promise you, it don't take that long. Like I was, what's today? Wednesday. So it had to be last Thursday. I was cooking. By the time I came to myself, I was finished. I agree on tap water. You don't know what kind of poisons are in it. I'm telling you. Just That's why folks be out here itching and carrying on. They be talking about I got eczema. No, you allergic to that water. Like, I can even tell the difference. Like if I go to, you know what I'm saying, visit my sister. She lives in Maryland, so the water is different. I can tell the difference in, you know what I'm saying, like bathing at her house and bathing here. Like, you know what I'm saying? Like, you know what I'm saying? If the lotion go on different, or you know what I'm saying, you gotta work a little harder to, you know what I'm saying, get your soap the lather up. Like, it just be little stuff. What you say, Draco? I cook all the time. Got burnt out on eating out. It all tastes the same, just different names on the building. I'm trying to tell you. Now it's Wednesday, so for those of y'all who know me, y'all already know I will be eating out tonight, because tonight is taco special night at the local Mexican restaurant. It is once a week. It's authentic hand rolled tacos. I will be in attendance. I will be there. And then we'll go back to, you know what I'm saying, back to the kitchen for Thursday, and then Friday, I don't know. I actually got invited to a dinner party, so I don't know. And then Saturday, I guess that's gonna be cheat day, since we're going to the Chill Wine Festival. We ain't really known for, you know, festival themed after, you know what I'm saying, soft drink that's really gonna be healthy, but we gonna make it do what it do. We gonna make it do what it do. But yeah, like I feel you those Rico, especially like when you know what I'm saying, door dashing. It all end up tasting like the same thing after a while. And sometimes, and then another thing I think we as Americans need to get comfortable with: it's okay not to eat. It is absolutely okay to not eat. Yeah, man. We still have chill wine. We still have chill wine, Draco. So yeah, Salisbury. That's actually where chill wine was created. They have a festival every year. Salisbury is like maybe 35, 40 minutes from here. So I'm gonna go check it out. And then, well, I need to see how that's gonna work. I might have to go to Taylorsville first, to get my burnt ends, and then circle back to the festival. Or I need to see if I can go to the festival on Saturday and then go to Taylorsville on Sunday for my burnt ends. But I'll make it work. I will make it work. Because I didn't get to go last week. I'm going to go this week. For my burnt ends. Matter of fact, let me look at that now. See if they're doing it. Because it's Wednesday. They should have said something like that. See how that's working. But yeah, we still got chill wine. Nope. Lord, here goes some more. What is this? Yeah, you can always count on Tommy Sotomayor for the info. Here go another video. These bras is that McDonald's? Yep, fighting in the McDonald's. She all behind the counter. Got the girl all hemmed up over by the fries. See, it's too much going on. It'd be too much going on. Hey, AT. So you did go to the gym when? Go to the gym when? This week. No. I went I go for my walks. So yeah, child's out there with my damn rain boots and slicker and hat on, trying to stay dry, but I got it in. Cause it's May, so we get ready to start our beach tour. I'm trying to decide if I'm gonna go next Sunday or Monday. I'm trying to decide. which one I'm gonna do. Yeah, because the festival this weekend. So then, yeah, next week there is Memorial Weekend. So I'm trying to decide if I'm gonna go Sunday or I'm actually go on Memorial Day. Because then I'm off. I took half a day on Friday, and then I have half a day on that Tuesday. So yeah, I'm gonna be kicking it. That's what it was, Apple City. But yeah, no, I've been getting it in, but I'm getting ready to so you gotta stop talking to friends. Cause now that a couple of my friend girls, they want to do the Cupid Shuffle core workout challenge for a week. So we discussing that. Oh yeah, they got the smoke fried. Yeah, okay. So y'all got the crispy Asian pork belly burnt ends and the smoke fried wings. Yeah, I don't none of that sound diet friendly, but we gonna see. Hold up, y'all got I go to Buc-ee's too. See, this how you get in trouble. This how you get in trouble, but it's gonna be all right. Okay, nope. They are not open on Sunday. So hell, we might go to let's see if they don't have them this weekend. I gotta get my life together, y'all, cause I gotta go back to Atlanta for my fitting, and I need to have myself together. So taking foodie road trips, you know what I'm saying, might not be the best course of action, but we're gonna make it work. We're gonna make it do what it do. We gonna make it do what it do. But yeah, beach tour is starting this month. I gotta go back. I gotta go next month for to get measured. She ain't started working on it yet. Get measured. And then let's see. Since May, June, then July is let's see, juice and protein smoothies for a week. Hey team, I got a whole protein smoothie here. It's what 60 grams of protein in this sucker. We got spirulina up in here. Dang, I done drank more than I thought I did. We gonna get it together. I got my water over here. I went to Trader Joe's the other day, and I got this. I got a bunch of cool stuff out of there. Y'all got the best body butter. Side note, I got the best body butter out of Trader Joe's. Y'all, when I tell you, listen, I'm over here smooth, child. That body butter is everything. But yes, I got that from Trader Joe's because I had to re-up on my tea tree shampoo and conditioner. And I found this blood orange hibiscus tea. Yo, it's on point. It's on point. So I got my protein smoothie I'm trying to get down. I got my water. I infused it with some orange zest. Y'all can't tell I love orange. And I have my tea. I know, right? So I went because I was on Instagram, and this chick's page popped up where she does, you know what I'm saying, bouquets, you know what I'm saying? She, you know, makes bouquets, whatever. So she, you know what I'm saying, was, you know what I'm saying, showing the different ones that she was doing for Mother's Day. And she, you know, went step by step, and you know, so with all pieces, you know what I'm saying, she used it where she got it, whatever. And so all of the, the bouquets that she used to make the one big one, she got from Trader Joe's. I was like, well, child, I know if you got it from over there, then, because they usually have, really good deals on, the flowers, like, the tulips and the roses and all that. So I was like, I need to go anyway. I got to wash my hair. Let me go ahead and get up and go ahead and go over here to Trader Joe's. Went over there. By the time I got there, they was literally putting this stuff out. So I got like first dibs on, all the flowers. So I got some beautiful roses, some peonies. I had really been wanting some peonies. So I did a bouquet for my mama, because this was my first, Mother's Day that she wasn't here. And then I did one for my grandma, like I always do. So yeah, man, I found some nice roses. They had real nice greeneries. I had some peonies, some tulips. Like, yeah, I was over there getting it inside and out of Trader Joe's. So yeah, got my little Trader Joe fix. What else did I get from over there? I got some good granola too. Yeah, so and then that's how I stumbled up on the body butter. Y'all, child, you don't need Bath and Body Works with that. Not at all. You don't even need Bath and Body Works with that right there. Just go on Trader Joe's, put your $6 on it, and come on out. And let that be that. And some yeah, they didn't have any sunflowers, but I'm sure they will. So yeah, when they do, I'm definitely gonna grab some. I think the last place I saw they had was Lidl, but it was kind of sunk looking. It was like it was a little dry, so I left it there. Now they have good flowers and like plants too. So yeah, between the two of them, but I need to go back to Lidl anyway, because y'all, they had the most amazing trail mix. Like, y'all, when I tell you, I got like 4 different kinds. Yeah. So one had dark chocolate, pecans, macadamia nuts, almonds, dried cranberries, walnuts, and raisins. Y'all, it's life. Then it was Trader Joe's was on it, and then I actually got some tangerine chicken. It was on sale. I haven't eaten it yet, because I ended up getting the Mardi Gras rotisserie from Publix yesterday. Y'all, for those of y'all who know about that Mardi Gras, all right, Death Note, appreciate you for stopping by. Don't blast on nobody in the meeting. Behave yourself. But yeah, 18. Listen, so then the other one had walnuts, pecans, almonds, and dried cranberries. Then there was another one. It had macadamia nuts, dried pineapple, coconut, and almonds. And then the fourth one, what the hell did it have? It had, oh, y'all don't even remember. It's in the kitchen. I have to look. Anyway, they was all like $5 a bag, but I mean, they was like really nice size bags. And like, I've literally had them since pumpkin seed. No, I don't think any of the ones I had pumpkin seed. Yeah, because I bought pumpkin seeds separately when I went to Sprouts, because I love pumpkin seeds. So I had bought them at Sprouts. And yeah, they opened up the Sprouts like 5 minutes from my house. I cannot wait. I love Sprouts. Because yeah, Sprouts is like a 35, 40-minute ride from my house. Where it is right now. But yeah, so that's what made. I bought those January. They've been in the freezer. Yeah. I don't. But yeah, that kind of stuff, like like oats and trail mix and all kind. Like, I love that kind of stuff. But yeah, it's time to re-up. You said, yeah, dried pineapples and banana slices are good in trail mix. Yeah, I found dried tangerines last night at Publix. I found a whole bunch of stuff that I did not go to Publix intending to get last night. I found dried tangerines. I found a yellow watermelon. I found I found my aloe water. What else did I find? It was a lot. It was a lot. It was a lot because they had a lot of buy one get one free. I guess y'all the eggs were down. Eggs were down. Yeah, Publix is the spot. Yeah, and I got my because I usually get either a tender sub, like I have them make me like a chicken cordon bleu, but instead of like the you know what I'm saying the deli chicken, I have them use the tenders. So I have like the chicken tenders, you know what I'm saying, and then you know what I'm saying, then the ham, and then you know what I'm saying the bacon and the honey mustard and all of that. So yeah, I'll be on my, you know what I'm saying, the Swiss and all that. I have to be on my cordon bleu. Or either I get, you know what I'm saying, wings. But they actually had the whole, because they usually don't, or maybe I just don't get there in time to catch them because I usually go when I get off from work. The body gras in the chicken, in the whole chickens. So yeah, y'all listen. So that's what we have in the, well, wait. No, that ain't gonna work. That's what we having tomorrow. It's the Mardi Gras chicken in a salad because they had some beautiful tomatoes and greens. They want to buy one get one. So yeah, I'm gonna make it do what it do. Oh yeah, that Mardi Gras. Ooh, child. But yeah, that's what's going on with that. Yeah, how long we been on here? 3 hours? I should act like I'm gonna do a little bit of work. Yeah, because it was something else supposed to be coming on later on this afternoon. I wanted to show. I think RFK might be coming back. You say you love ambrosia, cantaloupe, never tried yellow watermelon. Lit. Okay. So yeah. So I had yellow watermelon last year. Now I need to find the pink. It's the pink one. Got pink too. So you got your regular watermelon, you got yellow watermelon, and now it's like a pink. It look like pink lemonade. So I gotta find that one. I'm probably gonna have to go to the farmer's market. It's gonna be my best place to try to track that one down. So if I do, I will let y'all know. Yeah, they on lunch break. So yeah, I think RK coming back. So if he come back, we'll see what else is going on. But it was somebody else supposed to be coming on, trying to tell their side of the story. I figure it out. But it is about to be lunchtime, so I will let y'all go and enjoy your lunch. I will be back. Yeah, RFK coming back. We coming back, so we can hear the rest of this. So make sure you got your notifications on, and when he is back, we will be back, and we'll see who show out and who act like they got some good sense. Again, I appreciate each and every one of you for stopping by. Hit the like button if you have not. Make sure your notifications on. And I will see y'all in a few.